Good evening, everyone. Hope I'm audible and visible. Hope everything is fine. Good evening, good evening, good evening. Welcome to today's session. So, today we'll be talking about pharmacology. So, I have got such a type of questions which are very, very important and previously asked. Okay. So, we'll cover all of it. So, good evening and welcome to the session. All of you here, come on, jaldi jaldi join karo. हेलो सो आज हम ऐसा करेंगे, पहले तो सेशन के बारे में एवरीडे आई विल टेल यू व्हाट वी आर गोइंग टू डू. हेलो हेलो ऑल फाइन, बढ़िया. सो नाउ लिसन टू मी द थिंग व्हाट वी आर गोइंग टू डू टुडे. सो वेरी सिंपल एज दैट. आई हैव गॉट सम प्रीवियसली आस्क्ड द लास्ट 2 to 3 years क्वेश्चंस. ओके. सो पिछले 2-3 साल के अंदर जितने भी क्वेश्चन पूछा गए हैं, सो ऑल ऑफ देम आर हियर. एंड along with that the repeated ones and very confusing ones, and आज साथों साथ together we are going to study also some of the very important aspects. What are those? Like अगर मैं एक जगह पे कोई एंटीडोट आया, पॉइजनिंग आ गया, तो there only we'll study all the poisons together. Okay, hi Veer. So then we are also going to study about drug of choices. अगर एक आए तो उसके बारे में सराउंडिंग में जितने भी है, all of them we are going to study. All right. So when we are speaking of pharmacology, so what we are going to do is we'll start with the question solving session, right? So चलिए शुरू करते हैं. So the first question, which among the following is the antidote for benzodiazepines? चलो बताओ, जल्दी बताओ, आंसर बताओ. Which of the following is the antidote for benzodiazepines? So Rinkesh Kumar says the answer is A. Come on, everybody, quickly tell me. So the answer is A. Very good. What is that? Answer is A. So what is the answer? That is your, yes, importantly, that is A, flumazenil. What is that? Flumazenil. So flumazenil is the antidote used in the overdose of benzodiazepine. Sir, इसमें और क्या पूछते हैं? So इसमें if they want to go to the next level, so they will confuse you by asking the mechanism of this drug. So do not get confused by the mechanism of the drug. So we will study about it very easily. All right. Okay, so what is the antidote? Very good answer. The answer is flumazenil. ठीक है? What is the antidote? Flumazenil. Flumazenil is the antidote for the treatment of which disease? Benzodiazepine overdose. तो चलिए पढ़ते हैं benzodiazepines के बारे में first. Okay, so benzodiazepine overdose, what and all we need to remember. The first and most important, all the benzodiazepines what we have, BZD, benzodiazepines. What do we have? Benzodiazepines. They are agonist of which receptor? The first and most important, agonist at the receptor called as GABA receptor. कौन सी receptor? GABA, in which also subtype GABA A receptor. कौन सी? GABA A receptor का agonist होते हैं. So what benzodiazepine do? They increase the frequency of opening. Increase the frequency of opening. Frequency of opening. Opening of what? Opening. Frequency of opening. किस चीज का opening? Bottle का opening नहीं है. Chloride channel. It's not the bottle opening. It is a chloride channel opening. Which channel? Chloride channel opening. So chloride channels are basically what, sir? Basically they are your GABA A receptor. So benzodiazepines bind there, and your flumazenil. What is that? Flumazenil. Okay, flumazenil is a type of benzodiazepine antagonist. That is your GABA antagonist. GABA A antagonist. So the next possible question क्या पूछ सकता है? A patient was overdosed with benzodiazepine. क्या पूछेगा? Patient was overdosed with benzodiazepine, was given an antidote. What is the mechanism of the antidote? पूछेगा. ठीक है? What is the mechanism of antidote? Okay, so that is the answer. That is your flumazenil. चलिए आगे देखते हैं. What are the other options we have? This flunitrazepam. What is flunitrazepam? This is only called as a rape date drug. Rape date drug. Date rape or date rape drug. Okay, what is that? Date rape drug, called as date rape drug. Okay, what is this? Flunitrazepam, date rape drug. Okay, so this is only your, that is your flunitrazepam. So antidote, the treatment for antidote for the barbiturate overdose treatment. Barbiturate overdose का treatment होता है that is very important. That is your forced alkaline diuresis. क्या होता है sir? Forced alkaline diuresis. Forced alkaline diuresis. Forced alkaline diuresis. ठीक है sir? All right. What is this important aspect? Forced alkaline diuresis. Forced alkaline diuresis, we are trying to stop the reabsorption of what is that barbiturates from the proximal convoluted tubule. ठीक है सर? चलिए आगे बढ़ते हैं. Let's go to the next question. A child swallowed 20 iron supplement tablets while parents were busy and not paying the attention and was brought to the emergency. What is the antidote for iron toxicity? चलिए बताओ. Option A, vitamin B12 supplementation. Option B, BAL. Option C, deferoxamine. And answer D is your deferripiron. What is that? Deferripiron. Deferripiron. So, what is the antidote? जल्दी बताओ. तो क्या हुआ यहाँ पे? ध्यान से देखो क्या हुआ. दिस इज ए चाइल्ड हु swallowed कितना टैबलेट था? 20 टैबलेट. अरे बच्चे शरारती होते हैं, right? So children are naughty. We need to pay attention towards them. If we don't pay attention towards the children, what will happen? They will do this kind of things only. कितना का गया वो? 20 को tablet. How many? 20 tablet. After taking the 20 tablet, he was brought to the emergency, right? So what is the antidote? First, let's make the diagnosis, my dear students. What is the diagnosis here? So remember, diagnosis here is acute iron toxicity, acute iron overload, acute iron overload. ठीक है? So acute iron overload, what is the drug of choice? Let's see. Veer, Mohammed, Medlife, Abhishek, Sanjay, Abhishek, Nikhil, all of you are absolutely correct. What is the answer for the treatment for that? Is your C. What is that? C. What is that? Deferoxamine. What is the treatment? Deferoxamine. What is that? Deferoxamine. Okay. But sir, और अगर ये जो है ना deferripiron, this is also iron chelating agent. ये कब यूज करते हैं? And what is the importance we need to remember? Remember, for example, thalassemia. What is that? Thalassemia. What happens in thalassemia? Yes, there is a beta chain is absent or alpha chain. That is A chain of the hemoglobin गायब हो जाता है, absence हो जाता है, absence of alpha chain or a beta chain. So because of the alpha chain or a beta chain, what will happen? The treatment will be, so healthy hemoglobin is not there, so treatment is repeated transfusion. क्या कराओगे? Repeated transfusion. So repeated transfusion, whatever you are giving, that is for what is that? Thalassemia. So when you give a repeated transfusion can lead to what is that? Very important aspect. What is that? It will lead to chronic iron overload. What is that? Chronic iron toxicity. Chronic iron toxicity. Chronic iron toxicity. If the child is having a chronic iron toxicity, then the drug of choice, my dear student, the treatment is totally changed. So the drug we are going to use is the last option, that is your deferripiron. What is that? Deferripiron. So where do we use deferripiron? Deferripiron is used for the treatment of chronic iron overload, and for acute overload, what is the treatment? Deferoxamine. Okay, so iron chelating agent. There is one more drug, deferrirox, deferasirox. Deferoxyrox. But best drug you can answer is, the best drug is deferripiron. The treatment will be deferripiron. The treatment will be deferripiron. Okay. So this is a story of your, what is that? Acute and chronic iron overload. Okay. So the treatment is deferoxamine. Hope everybody is understanding this. Let's go to the next question. What is the next question? Okay. Which among the following SSRI drug used for the management of depression? वो सिंपल सा पूछ रहा है कि इसके अंदर से which are those drugs which is what? Selective serotonin reuptake inhibitor, SSRI. What is that? SSRI. So what is the drug used for the management of depression? चलो बताओ, जल्दी बताओ बच्चों, आंसर बताओ. Come on, quickly tell me. So we have option A fluoxetine, option B imipramine, bupropion, lithium. चलो बताओ जल्दी everybody. Very good answer, guys. What is that? Answer is your fluoxetine. What is that? Fluoxetine. So SSRIs, जितने भी SSRIs है fluoxetine, you have one more drug that is paroxetine. What is that? Paroxetine. Okay, so these are citralopam. There is a citralopam. So citralopam. So these drugs कहाँ पे use होता है? SSRIs. They are used in the treatment of depression. SSRIs uses are a very important ones to be remembered. So पहले एक बार list बना लेते हैं SSRIs use. So drugs we know paroxetine, citralopam, fluoxetine. SSRI drugs. We have drugs such as citralopam, even acetalopam is there. उनका यूज कहां पे होता है? These are drug of choice for premature ejaculation. Okay, it is not for erectile dysfunction. दोनों को अदला बदली मत करना. They are totally two different things, erectile dysfunction and premature ejaculation. चलो, what is the most common cause of premature ejaculation in India? Most common cause in India is usually, my dear students, psychogenic. What is that? Psychogenic. So that is only condition where we are going to use what is that? Premature ejaculation. We are going to use what is that? Drug of choice, SSRIs. SSRIs, my dear students, they are also used in obsessive compulsive disorder. They are also used in obsessive compulsive disorder. They are also useful in PTSD. They are also useful in PTSD. Where they are useful? PTSD, post traumatic stress disorder. ठीक है सर? So this is the story of your SSRIs. Okay. Now यहाँ पे जो दूसरे ड्रग है उनके बारे में बात करते हैं. इमिप्रामाइन होता क्या है सर? Tricyclic antidepressant. It belongs to a drug group called as tricyclic antidepressant. Tricyclic antidepressant में और भी drugs है, such as for example your amitriptyline, nortriptyline, imipramine, right? All of them belong to which group? Yes, very importantly, tricyclic antidepressant. So tricyclic antidepressants ka uses also very important MCQ which has been previously asked multiple times. So the first important point, remember this point, that is so it is not a drug of choice, but they are added along with the other treatment. Okay, understood? So tricyclic antidepressant kahan काम आते हैं? Tricyclic antidepressants are useful in important treatment, that is your depression, of course. Okay, along with the depression, we have next important uses. They are used for hyperactive bladder. Yes, hyperactive bladder में use कर सकते हो. Hyperactive bladder. Hyperactive bladder में the best drug used is imipramine. What is the drug used? Imipramine. What is the drug used? Imipramine. So that is used for the treatment of hyperactive bladder. And the next important point, ध्यान से देखो यहाँ पे, these drugs are useful in the prophylaxis of migraine. गलती मत करो इसको. Prophylaxis of migraine. माइग्रेन का प्रोफाइलैक्सिस में यूज करते हो, नॉट एज ए ड्रग ऑफ चॉइस. किस में यूज करते हो? अभी रिपीट करो. प्रोफाइलैक्सिस ऑफ माइग्रेन क्या यूज करते हो? ट्राइसाइक्लिक एंटीडिप्रेसेंट. डू नॉट मेक दिस मिस्टेक. दे आर नॉट यूज्ड एज ए ट्रीटमेंट फॉर माइग्रेन. दे आर यूज्ड एज ओनली फॉर व्हाट इज दैट? That is used for prophylaxis of migraine. So this is a very important point to remember. Then let's continue to the next important aspect. What is that? These drugs are also very much useful in nocturnal anuresis. What is that? Nocturnal anuresis. For that also we are going to use which drug, sir? Yes, that is your imipramine, such as amitriptyline, tricyclic antidepressant. Now यहाँ पे option C है bupropion. What is that? Bupropion. So even before going to the bupropion, so we also use one more drug. What is that? That is your propranolol. Okay, this is also a very important question. ये गलत मत करो. All of the following are used in the treatment of migraine prophylaxis except a previously asked question है, so do not make a mistake. Okay, now when we are speaking of the next important drug, that is your bupropion. कहाँ use होता है bupropion? So bupropion is a type of atypical antidepressant. It is a type of atypical antidepressant. Okay, so this atypical antidepressant used in smoking cessation. What is that? Smoking cessation. Okay, smoking cessation. Okay, so that is the story of your what is that? Bupropion. Okay, lithium कहाँ पे use होता है? For mania and bipolar disorder. disorder, bipolar disease. So this is the uses of, what is that, uses of that is your atypical antidepressant. So this is the story of your, what is that, treatment for your depression and other drugs which are useful. Okay, all right. So let's continue to the next important aspect. What is that? The next question. चलिए आगे बढ़ते हैं. So यहाँ पे जितने भी मैं पढ़ा रहा हूँ, हर क्वेश्चन इंपॉर्टेंट है. They are used repeatedly used in multiple conditions. Okay, चलिए आगे बढ़ते हैं. Chalo, let's answer the next question. 32-year-old male brought to the 3 bottles of alcohol from the liquor shop, later presented with drowsiness, ataxia, blurred vision. Which of the following is the antidote for the given condition? मैं कल ही सेम क्वेश्चन करवाया था. देखो कितना बार रिपीट हो रहा है क्वेश्चन. ओके, कल भी हम लोग किए थे. फार्मा में भी आता है, ये बायोकेम में भी आता है. ओके, सो which drug is used in this condition? Come on, tell me. A 32-year-old male brought to the hospital after drinking 3 bottles of alcohol. Yes, the answer is not A. Not A, sir. ये गलत हो जाएगा. Remember, naltrexone is a opioid antagonist. Opioid antagonist used for opioid overdose. Opioid overdose. गलती से भी ये मार्क मत करके आना. Please remember, used for opioid overdose. All of your answer B is correct. Ethanol is correct answer. अगर ethanol नहीं होता है, you can also give, what is that? You can also give, my dear student, very important, famipazole. What is that? Famipazole is also very widely used drug. Okay, so morphine and fentanyl, ये दोनों का overdose. For these overdose, we are going to use naloxone. Naloxone is the best answer. If naloxone is not there, you can go for naltrexone. If naloxone is not there, you can go for naltrexone. Okay, गलती मत करो इस चीज को. Naloxone and naltrexone. Okay, so what is the antidote for the ethanol overdose? Sorry, antidote for the ethanol overdose is famipazole. So यहाँ पे फिर से एक बार clear कर लेते हैं. For ethanol, the drug of choice. So this is the overdose. Okay, here is the treatment. Okay, so ethanol overdose, we are going to use famipazole. Okay, ethanol overdose, we are going to use famipazole. Okay, हाँ जी, PDF मिलेगी. Definitely at the end of the class, we will give the PDF to our team. Our team will upload it in the description link and you can find it later on. Okay. All right. For example, if there is a methanol overdose, the treatment of choice is your ethanol. अगर ethanol option में नहीं है, we are going to use famipazole. Okay, so this is the story of your, what is that? Story of methyl alcohol overdose. Okay, let's go to the next overdose, that is opioid overdose. For the opioid overdose, we are going to use opioid. क्या होता है? Opioid receptor को जाके stimulate करता है. What will they do? They stimulate the opioid receptor, because of which we have euphoria, loss of pain, all of it we get. Okay, but when we are speaking of opioid overdose, so opioid overdose के लिए the treatment of choice, my dear students, is naloxone. Okay, then for example, your warfarin overdose, we are going to use vitamin K. Warfarin overdose, vitamin K. ये दोनों vice versa भी use कर सकते हो. Vitamin K का overdose के लिए warfarin का overdose के लिए vitamin. Okay, so it's not for section, it's alternatives. Okay, I don't know what you are trying to tell me. I'm not sure. Okay, चलिए आगे बढ़ते हैं. Let's continue to the next one. What is that? Warfarin के लिए vitamin K. Sir, heparin के लिए, heparin का antidote is what? Heparin का antidote is your protamine sulfate. What is that? Protamine sulfate. Now ध्यान से सुनो, यहाँ पे ध्यान से सुनो. प्रोटामाइन कहाँ से आता है? प्रोटामाइन का सोर्स बताओ भाई. ओके इंसान कहां कहां जाके ड्रग्स खोजता है इसको लाइक वेयर ह्यूमन गोस एंड सर्चेस द ड्रग्स विल बी शॉक्ड वेयर डू यू गेट द प्रोटामाइन फ्रॉम source of protamine ध्यान से सुनो protamine comes from very important place so that is salmon fish what is that salmon fish okay now this salmon fish exactly which part of the salmon fish मतलब blindly salmon fish खा गया if you eat salmon fish will you get protamine no salmon fishes sperm okay from the sperm of the salmon fish we get protamine from the sperm of the salmon fish कौन सी ड्रग आता है प्रोटामाइन सल्फेट कौन सा आता है protamine sulfate okay so they're very important ones do not forget these antidotes okay then we will study the fewer other antidotes also later on so next we go to the next question okay what is that a HIV positive woman was not receiving treatment gave birth to a boy okay what is the newborn's initial course of management remember this is a direct question the drug used is nevirapine usually used is nevirapine if we are going to use that is clear okay now the nevirapine whatever we are going to use how long is the question so let's see what is your answer come on quickly tell me HIV positive mother gave birth so what is the treatment for the child so Pratisha says answer is B. What about the others? Come on guys, quickly tell me the answer. So कोई दिक्कत नहीं ये क्वेश्चन का आंसर पता नहीं है तो डरने का जरूरत नहीं है. So this is a slightly confusing question. Right now what we use, my dear students, we are going to use a single drug that is nevirapine for the 6 months. So the best we can do is nevirapine as a single one. D is the correct answer. D is the correct answer. Abdul, you are correct. Rinkesh, your correct answer is D. Nevirapine is used for the 6 months. I want you to remember this as a fact. Directly remember it is a fact okay it's a viral and a fact that is true okay acha your name I read it sorry it's an antiviral drug nevirapine for the this is the D answer D is the correct answer okay not 6 months 6 weeks only okay let's go to the next important Zidovudine, see, Zidovudine is not given for 6 weeks. If Zidovudine is given also, we will give it for a longer period of time. That is why we don't mark that as correct answer among the given. That is your what is that nevirapine only. Okay, all right. Let's discuss about the next question. So, चलो मैं बताता हूँ. I'll put it at the end क्योंकि मुझे questions अभी आगे पीछे हो जाएगा. At the end of the questions, I'll teach you people. Okay, no problem. All right, a group of friends planned trip to Ladakh. One of them started having headache, nausea, okay, nausea, dizziness, exhaustion symptoms while they were there. Which of the following is the best course of action for this patient? Okay, so पहले तो एक clear कर लेते हैं what is there. So what is the case? So there is a case of what disease also we need to know and other drugs also. Okay, चलिए. Then we have sumatriptan, acetazolamide, scopolamine and promethazine. So these are the options we have. What is the drug of choice? Okay, come on. ये बहुत बार confuse कर लेते हो. That is why tell me the answer quickly. Come on. Scopolamine patch before the night. Others are saying answer B. Okay, ध्यान से सुनो. यहाँ पे एक while going नहीं बोला, while they were there. while going हुआ तो motion sickness. while going मतलब ऐसा height में जाने वक्त हुआ होता तो mountain sickness, motion sickness. while traveling if it has happened, that is a motion sickness. motion sickness का symptom होता है उल्टी. what is that? vomiting will be the major symptom of motion sickness. It is not a case of motion sickness. It is a case of that is your mountain sickness. It is a case of mountain sickness. It is a case of mountain sickness. Okay, so ध्यान से सुनो. It is a case of mountain sickness. तो चलिए पहले mountain sickness के बारे में थोड़ा बहुत पढ़ लेते हैं. So we go to high altitude. We go to high altitude. At the high altitude what will happen? Decrease of partial pressure of oxygen. मतलब atmosphere में partial pressure क्या होता है? कम हो जाता है. atmosphere में partial pressure कम होता है. immediately हम लोग क्या करेंगे? अगर partial pressure if it is reduced, what your body will do? So you are start going to breathe faster because you want to provide more oxygen. While you are breathing faster, automatically then there is an increase of CO2 loss. So if there is an increase of CO2 loss, that will lead to what is that? All the symptoms like a headache, nausea, etc. Okay. So these are the clinical features. Clinical features आएगा, what is that? Headache, अगर dizziness, etc. Now the patient will end up having which alkalosis or acidosis? Respiratory alkalosis. Respiratory alkalosis. ध्यान से सुनो, anywhere if CO2 is lost, that is respiratory alkalosis. Respiratory alkalosis. So the treatment of choice, the drug of choice for this condition is your answer B, acetazolamide. Acetazolamide is what? Acetazolamide is a carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor. So when you give a carbonic anhydrase inhibitor, ध्यान से सुनो, carbonic anhydrase is the enzyme which will be present in your lungs. Lungs में भी आता है, even present in the eye also. So it is present in the kidney, it is present in the eye, and also it is present in your, what is that, lungs also. If you inhibit carbonic anhydrase in the lungs, what will happen? So lungs में inhibit करोगे तो क्या होगा? That will decrease the loss of CO2. That will decrease the loss of CO2. So the treatment will be, what is that? Acetazolamide. Okay, acetazolamide. कोई गलत नहीं करेगा. Acetazolamide. Okay. Now the next one, sumatriptan. Sumatriptan is a drug of choice for migraine attack. For the migraine attack, the first drug, the best drug used during the attack of migraine, not for the prophylaxis. ये गलती मत करना sir. Okay, for the drug of choice for the prophylaxis of migraine is the tricyclic antidepressant and your propranolol. अगर patient को headache लेके आएगा, sir I am having headache right now, then your treatment will be your, what is that? Yes, that will be your sumatriptan. Triptans are the drug of choice for very important condition. What is that? That is for the migraine attack, acute attack of migraine. Very good answer, Rinkesh Kumar. So then we will talk about the some sicknesses and their drug of choices. Okay. So first one is the mountain sickness. All of you know already mountain sickness. Then you have a motion sickness and you have a morning sickness. We have a morning sickness. Okay, so morning sickness, mountain sickness, motion sickness, morning sickness. So what exactly is this mountain sickness? All of you know already, it is acetazolamide. Acetazolamide क्या होता है? Acetazolamide. For the motion sickness, depends on the duration of travel. Okay, if travel duration is less than 24 hours, we can consider promethazine. What is that? Promethazine. What is promethazine? Promethazine is an antihistamine. सर क्या होता है? Antihistamine. Can consider. यहाँ पे ध्यान से दो, एग्जाम के बाद लड़ाई मत करना मेरे से. Can consider, but best drug of choice is that is your best DOC is your scopolamine. What is the drug of choice? Scopolamine. What is that? Scopolamine. It is given in the form of a patch. At least ideally speaking, when are we supposed to use this? कब use करना है पता है? 4 hours before the start of the journey. 4 hours before journey, the patient has to apply your, what is that? That is your motion sickness patch, scopolamine. इसका दूसरा नाम होता है hyoscine. ये कहाँ से बनता है? It is a type of plant derivative drug, sir. What is that? Plant derivative drug. Oh, very good answer. Okay, at least 4 hours is most important. Okay, देन यहाँ पे देखो मॉर्निंग सिकनेस के लिए सब लोग मार्क करके आते हैं सिंगल ड्रग. Actually the best combination, okay, best combination is your, what is that? That is very important, doxylamine. What is that? Doxylamine क्या होता है? Is a type of antihistaminic drug which is useful in the treatment of morning sickness in a pregnant female. Along with that we are going to use vitamin B6, that is pyridoxine phosphate. But if symptoms are mild, symptoms, अगर बहुत light symptoms, so थोड़ा बहुत nausea होता है and after that nothing else is there, slightly vomiting can be there but her life is not being affected. If very mild symptoms, then only thing we can do is reassurance. बोलना है कोई दिक्कत नहीं है, it is normal in pregnancy, ये होता रहता है, this will happen during the pregnancy, it's fine, very mild symptoms, don't treat it until and unless if it is become a very severe morning sickness. The best drug is your doxylamine plus vitamin B6, vitamin B6. okay, so चलिए आगे बढ़ते हैं, लेट्स गो टू द नेक्स्ट क्वेश्चन। ये क्वेश्चन भी यार बहुत बार पूछता है, विच ऑफ द फॉलोइंग ड्रग अंडरगोस हॉफमैन्स डिग्रेडेशन। ओके, ऑप्शन दिया हुआ है सिसाट्राक्यूरियम, मीवाक्यूरियम, पैनक्यूरोनियम एंड वेक्यूरोनियम। yes, I am covering all the PYQs from the past 2 to 3 years. अगर क्वेश्चन बार बार रिपीट हुआ है तो आई एम टेकिंग इट वंस ओनली, तो अरे इसलिए। ओके, ऑल राइट, बताओ जल्दी। वेरी गुड, बीजीएमआई, प्रत्युषा, कम ऑन, अदर्स आल्सो टेल मी योर करेक्ट आंसर। आंसर इज वेरी गुड, दैट इज योर Cisatracurium. Cisatracurium. Cisatracurium is a type of very important drug which undergoes Hoffman degradation. Sir, Hoffman degradation होता क्या है? No problem. So Hoffman degradation, पहले तो ये सब लोग तो रट लिए, Hoffman degradation क्या होता है? मेरा like you know I have seen this. Okay, I was asking why were a student and I asked which are the drugs which undergo Hoffman degradation. ठीक है, वो बोलता है कि सर atracurium and cisatracurium, पूरा confidence. Okay. So the next question I asked was, what is Hoffman degradation, beta? Okay, he's like, sir, what? Okay, so first understand Hoffman degradation is what. See, Hoffman degradation actually it is not enzymatic. Yes, in renal failure they can be used. Okay, I'll talk about that only in renal, especially hepatic failure. Okay, so चलो ध्यान से सुनो यहाँ पे, Hoffman degradation का सीन क्या है? Hoffman degradation is the molecular rearrangement. It is a type of molecular rearrangement, but there is no enzyme activity. ये बहुत important. What is that? No enzyme activity, needed. So now let's understand. So please listen to me. What exactly happens is these atracurium and cisatracurium, they does not require enzymes. मतलब liver का जरूरत नहीं है. It does not require the liver. Spontaneously it will undergo rearrangement of its molecules within itself. Molecules will undergo rearrangement within itself. So what are the drugs which undergoes Hoffman degradation? We have two drugs. That is the cisatracurium, and also your, my dear students, atracurium. So these drugs will create one compound, especially atracurium, but this will also create a light amount. Once it gets metabolized, it creates a product. Sir, इसका product बनता है क्या? Hoffman degradation, वो अपने आप spontaneously change, okay, spontaneously it will change itself, molecular rearrangement, and it will form a product is laudosine. Okay, laudosine. Okay, भाई इसको गलत प्रोनाउंस मत किया करो. It's called as laudosine. That's it. Okay, it's called as laudosine. Okay, so what is that? That is your metabolite of your cisatracurium. ठीक है, हाँ, फिर इसको मतलब बहुत ये लेके क्या करते हो, like you know pronounce करोगे तो फिर गड़बड़ हो जाएगा मामला. ठीक है, so that is laudosine. Now what is molecule, what is Hoffman? Clear. What are the drugs which undergo? Clear. And what is the product? Clear. तो सर अगर एंजाइम का एक्टिविटी नहीं चाहिए, it does not require enzyme activity, then what is there, sir? Then very nice na boss. Why very nice? Because it can be safe to use in liver failure patients. Why? Because liver itself is not required. Liver itself is not required for their metabolism. They undergo metabolism apart from the liver. That is why. Okay. So this is the story of your atracurium and cisatracurium. ठीक है सर, चलिए आगे बढ़ते हैं. After undergoing lithium therapy for a year, all of the following adverse effects are visible except. Okay, मतलब lithium यूज करने के 1 साल के बाद क्या नहीं दिखेगा? Okay, that is hypothyroidism, tremors, diabetes insipidus, tardive dyskinesia. चलो बताओ. Come on, tell me the answer guys. क्या नहीं दी? ध्यान से क्वेश्चन पढ़ते हुए. Except. Okay, what is not seen except? Okay, Pratyusha, Rinkesh Kumar, come on others. You people are saying क्या नहीं दिखेगा, tardive dyskinesia is not seen. So you people are telling what is not seen. Veer, yes, correct answer, all of you are correct. What is not seen? Tardive dyskinesia is not seen. देखो ध्यान से देखो, tardive dyskinesia is not seen. ट्रेमर तो जरूर दिखेगा लिथियम के अंदर, ठीक है। तो चलिए थोड़ा बहुत लिथियम के बारे में पढ़ ही लेते हैं आज। Okay, what is this lithium? Lithium is a drug which is used in the form of, पहले क्वेश्चन तो मेरा ये है, how do we give lithium? मतलब सीधा बैटरी, मतलब फोन का बैटरी खोलो लिथियम डोप दो, सीधा दे सकते हो ना लिथियम। कैन वी गिव फोन बैटरीज लिथियम टू ए पर्सन? नो। द ड्रग लिथियम इज यूज्ड एग्जैक्टली कैसे देंगे? इन द फॉर्म ऑफ लिथियम सिट्रेट। व्हाट इज दैट? लिथियम citrate, and there is one more drug called as lithium carbonate, lithium carbonate and lithium citrate, lithium carbonate and lithium citrate. Okay, so the next important aspect is lithium citrate and carbonate. So when we are speaking of lithium, it requires therapeutic drug monitoring. What is that? It require therapeutic drug monitoring. Therapeutic drug monitoring again बहुत लोग confuse होते हैं। अगर if you tell a therapeutic drug monitoring, if you directly check the level of drug, if you directly check the amount of drug in the bloodstream, you are directly checking what? Amount of drug in the bloodstream, then we call it as tedium. Okay, for example, so what is this? For example, what we are doing, we are doing INR level for warfarin, okay. For warfarin, what we are doing? INR level. Now the question is it TDM? Is it TDM? So INR level check कर रहे हो, you are checking for INR. So is it TDM? Option A is yes, option B is no. जल्दी बताओ, yes or no? TDM है कि नहीं है? Is it therapeutic drug monitoring or not? अरे इसके ऊपर क्वेश्चन आया हुआ है भाई। Yes, there is a lot, multiple times it has come. चलो बताओ, yes or no? I am waiting for the answer. Come on, guys. So TDM level done for warfarin is ध्यान से देखो, is not a TDM, is not a TDM. It is not a TDM. You are not checking the level of warfarin. You are checking the level of INR. हाँ, इसीलिए यही तो गलती है। INR is not a TDM. INR क्या होता है? How much of the clotting and bleeding को check करता है. It will not check the level of warfarin ना। अरे मैं इतना प्यार से, मतलब इफ आई एम मेकिंग द ट्रैप, इतना प्यार से ट्रैप बना रहा हूं और तुम उसी के अंदर घुस रहे हो। INR more than 1 is not an indicator for stop. Okay, is not an indicator for stop. INR we maintain 2.5 also, some cases 1.5, 2.5 like that also. Okay, it's not a stop level. So remember, it is not a TDM. मतलब क्या होता है सर? INR is a international normalized ratio. Okay, so ध्यान से देखो, it is not a TDM. If you are doing any other test, it is not a TDM. It is not a TDM. Okay, मुझे पता था आप लोगों को एक confusion आएगा, तो आज से never get confused. If you are measuring the drug level itself, मतलब if you are measuring the warfarin level itself, then I will call it as a TDM. But if I'm doing any other test, it is not a TDM. It is not a TDM. Any other test is not a TDM. Only if you are measuring the drug level, then it is TDM. गलती मत करो. So the drug which require the TDM are your lithium is required. Lithium it will need. Okay. Then your digoxin will need your, what is that? Yes, therapeutic drug monitoring. They will also require your phenytoin. What is that? Phenytoin. Then your heparin, not low molecular weight heparin and all, the unfractionated heparin. Okay, chalo. So heparin, and along with the heparin, so there is one more drug called as थियोफाइलिन. ये सारे ड्रग्स के लिए यू आर रिक्वायरिंग थेराप्यूटिक ड्रग मॉनिटरिंग. प्रीवियसली क्वेश्चन आया हुआ था, ऐसा क्या होता है? सो मोहे हो जाएगा. सो बी केयरफुल. ऑल ऑफ द फॉलोइंग रिक्वायर थेराप्यूटिक ड्रग मॉनिटरिंग एक्सेप्ट पूछेगा. ऑल ऑफ द फॉलोइंग रिक्वायर टीडीएम एक्सेप्ट. सो लिथियम रिक्वायर्स, डिजॉक्सिन रिक्वायर्स, फेनेटोइन रिक्वायर्स, हेपारिन रिक्वायर्स, थायोफिलिन रिक्वायर्स. ओके, चलिए आगे बढ़ते हैं। लिथियम का यूज, लिथियम का यूज, ओके, लिथियम का यूज क्या होता है? लिथियम का यूज फॉर द मेनिया एंड बाइपोलर डिसीज, मेनिया एंड bipolar disease, and the next important point to be remembered is, guys, please understand mania and bipolar disease. Okay, so mania and bipolar, and the patient will also have it's like one episode of mania था, मतलब आ गया था, ए हम ये करेंगे, we'll do that, we'll go run there, we will run 25 kilometer, over energetic. Okay, this is a slightly mania. Okay, मतलब ये पागल नहीं है, ये पागल नहीं है, ये तुम्हें ले जाए, he is not a mental guy, he is the one who is going to take you somewhere and put you into the problem. Okay, come bro, we will ride the bike in 200 speed. Okay, वापस आओगे या मोए मोए हो जाओगे पता नहीं. Okay, so that is a mania. Okay, so mania का prophylaxis में भी यूज आता है सर, mania's prophylaxis था, mania's prophylaxis. Okay, so this is the story of your what is that lithium. But lithium का सर साइड इफेक्ट जो है ना बहुत इंपॉर्टेंट है. The side effects of lithium, please remember sir, the side effects of lithium, it will cause tremors. Yes, very fine tremors. Yes, it will cause the tremors, fine tremors आता है. Yes, होता है. Then let's go to the next important. The patient will have ECG changes. What is that? ECG changes आएगा, जरूर आएगा ECG changes. Then also patient will develop hypothyroidism. ये confuse मत होना, hypothyroidism, hypothyroidism. Okay, now the next one, other side effect is, remember, so you are also getting nephrogenic diabetes insipidus. ध्यान से देखो, nephrogenic diabetes insipidus, nephrogenic diabetes insipidus. The treatment for the nephrogenic diabetes insipidus is, what is the treatment for this? Is amiloroid. What is that? Amiloroid. Okay, amiloroid is the drug of choice for the treatment of nephrogenic diabetes caused by lithium, caused by lithium. So amiloroid only if lithium induced, lithium induced, गलती मत करना, only if lithium induced, only if lithium induced, the drug of choice is your, what is that? That is going to be your amiloroid, amiloroid. This is also a drug which is a teratogenic drug. It is a teratogenic drug, teratogenic drug, and also it is a very important point, why it is teratogenic, and is there any important? Yes, it will cause Epstein's anomaly. What is that? Epstein's anomaly. Okay, so this is the story of your lithium side effect. And remember, never develop lithium के वजह से we never develop what is that? Extra pyramidal symptoms, extra pyramidal symptoms. तो extra pyramidal symptoms किससे आता है सर? Antipsychotics. Extra pyramidal symptoms, extra pyramidal symptoms are seen with the antipsychotics. Tardive dyskinesia is a extra pyramidal symptom, extra pyramidal symptom. It is seen with antipsychotics. Which drug? Antipsychotics. ठीक है, गलती मत करो, मुझे पता था ये कंफ्यूज हो जाएगा. एंड टीडीएम वाला क्वेश्चन तो बहुत इंपॉर्टेंट, ठीक है, बहुत इंपॉर्टेंट. चलो आगे बढ़ते हैं. लेट्स गो टू द नेक्स्ट क्वेश्चन. In carcinoma of cervix, which chemotherapeutic agent is used? Paclitaxel, cyclophosphamide, cisplatin, topotecan. टोपोटिकन. ओके, चलो इसको ड्रग को ये मतलब टेक ए वाइल्ड गेस, टेक ए वाइल्ड गेस. Very good. Both typical and atypical, both of them can cause predominantly by your typical ones. चलो, in carcinoma of the cervix क्या यूज करोगे? Some people are telling B, okay, others C. Okay, come on, quickly tell me. सो रिमेंबर, अगर कुछ भी पता नहीं है, ऐसा हो गया एग्जाम के अंदर गए, कैंसर, कोई एक कैंसर का ड्रग ऑफ चॉइस पूछ लिया और तुम चौंक गए. ओके, यू आर लाइक ओह माय गॉड, व्हाट टू डू. डू नॉट गेट स्केर्ड. ओके, दैट टाइम थिंक ऑफ मी. एक गुरु थे, एक बताए थे एक बात था, जब भी आंसर पता ना हो कैंसर ट्रीटमेंट के लिए, मेरा नाम लेके आंसर करो सिस्प्लैटिन. ओके, answer karo cisplatin. Cisplatin is the widely used chemotherapeutic agent. Okay, cisplatin is a widely used chemotherapeutic agent. Okay, so now remember, cisplatin is the most emetogenic. This is a very important question. Most emetogenic. hematogenic matlab among all the anti-cancer drugs the highest vomiting is caused that is highest vomiting is caused by your what is that is your cisplatin. Okay, now cyclophosphamide, sir, cyclophosphamide gives a metabolite what is the metabolite? The name of the metabolite is called as acreolin. What is the name of the drug? Acreolin. So this fellow acreolin is responsible for hemorrhagic cystitis. Hemorrhagic cystitis. It will cause a hemorrhagic cystitis. So cystitis. Okay, so when we are talking about cystitis, okay, so what is the treatment for the hemorrhagic cystitis? सबको याद रखे रहिएगा, मेसना. What is that, sir? मेसना. What is that? मेसना. ठीक है, so the answer is मेसना. Okay, so यहाँ पे देखो ये ब्लैडर कैंसर में काम नहीं आता है. साइक्लोफॉस्फेमाइड widely used in leukemias. So usually drug of choices नहीं आएगा. ठीक है, so mesna is for the cyclophosphamide caused what is that? Hemorrhagic cystitis. Hemorrhagic cystitis is also caused by cyclophosphamide. तो high dose में करता है. Cyclophosphamide causes in the high doses only, but acreolin is a metabolite which causing what is that? That is acreolin also comes from one more drug called as इसका बाय e-phosphamide. तो पक्का जरूर करेगा, मतलब definitely it can cause hemorrhagic cystitis. High probability इतना e-phosphamide. It is more potent drug. So e-phosphamide and cyclophosphamide. Very simple story. They give a metabolite acreolin causes hemorrhagic cystitis. What is the treatment of choice? Mesna. What is the treatment of choice? Mesna. Okay. Apart from that, we can also give a bladder wash. It is a hemorrhagic cystitis, but non-infectious hemorrhagic cystitis. Okay, sir. So this is a story of your what is that? That is your next question. चलो आगे बढ़ते हैं. Let's go to the next question. What is this? Which of the following drugs can cause thymine less death of a cell? Thymine less death of a cell. That options we have are 6-mercaptopurine, 5-fluorouracil, methotrexate, azathioprine. चलो ड्रग ऑफ चॉइस बता दो, आप गेस करो. इनके बारे में सब कुछ मैं अभी 2-4 मिनट में क्या क्या पूछ सकता है, हम क्या क्या आंसर करना है, पक्का तैयारी कर देंगे. ठीक है, टेंशन ना लो. टेक ए गेस. क्या है? थाइमिन नहीं है. क्या नहीं है? थाइमिन नहीं है. थाइमिन के बिना मारेगा सेल को. which cells will get killed because of lack of thiamine? That is your which one? Come on, tell me. So Rinkesh says treatment is C. Others? Veer says it is B. Okay, Aarti says it's B. Others? Pratyusha answer is C. You're telling. So पहले एक ध्यान से सुनो. थाइमिन इज व्हाट? पहले ये देखो, THI है कि THY? अरे ध्यान से देखो तो सही क्या दिया हुआ है. थाइमिन THY दिया हुआ है, THIA नहीं है. देयर इज नो THIA देयर इज THY. THIA, thiamine is your B2. Okay, thiamine is your B2, vitamin B2. THY, thiamine is a type of purine. Thiamine is a type of purine, sir. Thiamine is a type of purine. Okay, so purines are responsible for, they form the DNA. Okay, they क्या बनाते हैं? DNA को बनाते हैं. So we have one drug that is called as a 5FU, that is purine antagonist. Sorry, it is not a purine. Sorry, mistake. Blender हो गया. Pyrimidine as blender हो गया. Okay, adenine and thymine are your what is that? Thymine are pyrimidines. Sorry. Okay, they're responsible for the DNA. So we have something called as two groups of drugs. So anti-cancer drugs. Okay, anti-cancer drugs such as called as anti-metabolites. What is that? anti-metabolites. These anti-metabolites what they will do, they inhibit DNA synthesis. Usually they inhibit DNA synthesis. वो कैसे भी करके, if they inhibit the DNA synthesis, automatically cells will not replicate, so that will be what is that, breakdown will happen. Okay, now listen to me, ध्यान से देखो यहाँ पे. Now, what is that? Pyrimidines. So we have purine antagonist. Purine antagonist. Basically, these are the drugs which are going to inhibit, what is that? They are going to inhibit the purine synthesis. They will inhibit the purine synthesis. Okay. Okay. So purine antagonist, we have 6-mercaptopurine. 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 Okay, then we have one more drug, that is your pyrimidine antagonist. Okay, so pyrimidine antagonist, they are your, please remember, pyrimidine antagonist are your pyrimidine antagonist is your that is 5-fluorouracil. 5-fluorouracil. Whenever you give a 5-fluorouracil, it will inhibit thymine synthase. What is that? Thymine synthase. It will inhibit which enzyme? Thymine synthase. Okay, please ध्यान से सुनो. That is thymine synthase. Okay, so thymine synthase inhibit हो जाएगा. So thymine synthase, if it gets inhibited, what will happen? Of course, what will happen? There is a decrease of, what is that? That is your DNA formation. So if DNA formation is reduced, automatically what will happen is your no replication of the cancer cell. If there is no replication of cancer cell, automatically what will be there? Yes, what will be there? Automatically cancer treatment will be there. Okay, so let's go to the next important aspect. What is the, 1 second guys, मुझे comment suddenly गायब हो जाते हैं भाई, आ जाओ. Okay, all good. Okay, so ये हो गया कौन? आंसर इज 5-fluorouracil. 5-fluorouracil करता क्या है? इनहिबिट करता है थायमीन सिंथेस को, ओके. एंड 6-mercaptopurine तो किसको बंद करवाता है? प्यूरिन एंटागोनिस्ट. व्हाट इज दैट? प्यूरिन एंटागोनिस्ट. ओके, सो that is a story of your, what is that? That is your the 5-fluorouracil and mercaptopurine. अब देखते हैं MTX, methotrexate है, बहुत फेवरेट ड्रग है, methotrexate. So methotrexate is such a type of drug. It will inhibit. अरे कंफ्यूज मत हो भाई, थायमिन इज ए pyrimidine. ओके, अरे ये बाइंड्स विथ T, G बाइंड्स विथ C, राइट? ये याद है ना, ये किसके साथ बाइंड करता है? T. G किसके साथ बाइंड करता है? C. ओके, ये दोनों हो गया कौन? प्यूरिन्स. ये दोनों हो गया कौन? pyrimidines. That's it. ओके, ये हो गया प्यूरिन्स, ये हो गया pyrimidines. ओके, थायमिन इज B1. यस, वेरी करेक्ट आंसर. थायमिन इज B1. चलिए, methotrexate will inhibit one enzyme called as DHFR, dihydrofolate reductase. ठीक है. सो डाइहाइड्रोफोलेट रिडक्टेस का इनहिबिटर कौन होता है? methotrexate. What is that? methotrexate. So this DHFR inhibition, automatically it will lead to decrease of folic acid. अगर folic acid नहीं है तो no nucleotides. What is that? No nucleotides. ठीक है, there is no nucleotides. So decrease of folic acid. Decrease of what? Folic acid. Nucleotides नहीं बनेगा. So methotrexate is very toxic. It is toxic to bone marrow. Very toxic to, what is that? Bone marrow. It is very toxic to which tissue? Bone marrow. ये बहुत important question है, because methotrexate, it is toxic to bone marrow at any dose. मतलब small dose में दो, large dose में दो, कैसे भी करो, कुछ भी करो, any dose, at any dose, it will cause one dangerous side effect: suppression of the bone marrow. It is used in the lymphomas and other types of cancer, and also used in a very aggressive autoimmune diseases, and this can lead to can lead to one problem. What is that? Can lead to decrease of folic acid in the body, decrease of folic acid in the body. So body के अंदर folic acid कम होता है, then for that treatment is ट्रीटमेंट यहाँ पे अगर ऑप्शन दिया है फोलिक एसिड ऑप्शन में दे दिया तो फोलिक एसिड नहीं मार्क करना चाहिए, बिकॉज what will happen, it is inhibiting this enzyme. तुम 10 किलो फोलिक एसिड दोगे तो भी फायदा नहीं होगा. treatment is called as leucovorin. What is that? Leucovorin का दूसरा नाम होता है, the other name of leucovorin is called as folinic acid. ध्यान से देखो कौन सी एसिड दोगे? Folinic acid. Folinic acid is the drug of choice for the treatment of methotrexate overdose. कंफ्यूज मत करना, कंफ्यूज नहीं होना है. Folinic acid गलती से भी एग्जाम के दिन गए सर मेथोट्रेक्सेट नहीं था, मेथोट्रेक्सेट दिए, फोलिक एसिड कम हो रहा था इसलिए न्यूक्लियोटाइड कम हो रहा था. So that is why we thought okay now no folic acid, now we'll just give folic acid. If you give folic acid also it's of no use. Why? Because ये फोलिक एसिड कन्वर्ट होता है टेट्राहाइड्रोफोलिक एसिड will get converted into tetrahydrofolate. That conversion requires this enzyme. If this enzyme is not there, even if you give folic acid, it is of no use. The folic acid of no use when there is an overdose of methotrexate. So that is why we are going to give what is that? Folinic acid. Folinic acid is something like a tetrahydrofolate. Okay, confuse mat hona. Normally folic acid whatever is there, folic acid used to get converted. Folic acid used to get converted into tetrahydrofolate. Okay, so this tetrahydrofolate conversion is done by DHFR. So this used to get into the DNA production. This is what methotrexate blocked the folic acid conversion. So tetrahydrofolate will be not there. There is no DNA. This is how it was working. Okay, now leucovorin if you give, automatically it will go where? It will go as a tetrahydrofolate. It will go as a methyl tetrahydrofolate. So that is why we are using what is that? Leucovorin or a folinic acid. Hope that is clear so far everything. समझ में आ रहा है कि नहीं आ रहा है? All right, so we're done with what is that? Methotrexate. Methotrexate ka side effect be done. Okay, then most important in one more this thing is there. Alopecia is most commonly caused by alopecia by which drug? Vinca alkaloids, vincristin and vinblastine. Okay, vincristin and vinblastine will lead to what is that? That is your alopecia. Okay, so this is the story of your what is that? That is your anti-cancer drugs which are previously asked, like cyclophosphamide, azathioprine, all of them are done. Okay, chalo let's go to the next question. What is a drug of choice for CMV retinitis? Chalo bata do. All right, ऑप्शन ए कोट्राइमॉक्सोजोल, वालासाइक्लोविर, टिनोफोविर, गैनीसिक्लोविर. ओके, व्हाट इज द ड्रग ऑफ चॉइस? जल्दी बताओ. So remember Veer and Pratyusha people are absolutely correct. For the CMV retinitis, for the cytomegalovirus causing retinitis, the answer is best answer is your Ganicyclovir. What is that? Ganicyclovir is the drug of choice. गलती मत करना. Ganicyclovir is the drug of choice for CMV retinitis. It is a fact भैया, याद रखना ही पड़ेगा. You need to remember it is a fact. CMV retinitis drug of choice is not cotrimoxazole, Ganicyclovir. What is that? Ganicyclovir. Please do not get confused. Okay, cotrimoxazole. See, cotrimoxazole is a combination of two drugs. Cotrimoxazole is a combination of two drugs. Okay, so CO for combination, trima for, you can remember trimethoprim. What we are going to use? Trimethoprim. Okay, trimethoprim. Oxazole is for sulfamethoxazole. What is that? Sulfamethoxazole. Sulfamethoxazole. So this is the drugs. Okay. Yes, very good. Okay, trimethoprim and sulfamethoxazole. Okay, so this is a very important drug. This is cotrimoxazole. Cotrimoxazole is a drug of choice in which condition? Drug of choice in pneumocystic pneumonia. What is that? Pneumocystic pneumonia. Okay, what is pneumocystic pneumonia? Okay, pneumocystic pneumonia. Okay, तो ये होता क्या है सर? न्यूमोसिस्टिक निमोनिया इज आल्सो कॉल्ड एज पी जेविरोकाई, पी जेविरोकाई. Okay, P Jevirokai. Okay, please do not get confused. It is a drug of choice in PCP, pneumocystic pneumonia, which is also called as Jevirokai. Pneumocystis Jevirokai, pneumocystic Jevirosi. It is seen in HIV patients, seen in AIDS patient, seen in HIV patient, if less than 200 CD count. Okay, so if less than 200 CD count, we can encounter pneumocystic pneumonia or pneumocystic Jevirokai. The drug of choice that time is sulfamethoxazole. Sulfamethoxazole, that is only your cotrimoxazole. Okay, and it is also used in toxoplasmosis. Okay, toxoplasmosis. Clear? HIV pneumonia, I want you to remember, it is seen in the HIV patients majorly, and it is seen at the level of less than 200 CD count, and it is a type of atypical pneumocystic Jevirokai is a type of atypical pneumonia. It's a atypical form of pneumonia. It's a atypical. Okay. Very good. Pradeep Yadav, Bhavesh Patel, you people are absolutely correct. Let's continue. Pratyusha, you are also correct. So let's continue to the next question. Okay. Chaliye sir, answer karo ye question ko. In 55-year-old male with the complaint of urine hesitancy, complaints of urine hesitancy and retention of urine comes to the emergency room. On investigation, USC showed the residual urine of 130 ml. ध्यान दो यहाँ पे कितना है? 130 ml. Okay, which of the following drug is used in the treatment of this patient? Okay, चलो पहले ये बताओ, 130 ml means कितना पेग बनते हैं इसमें? बताओ एक्सपर्ट्स. So options are calcium channel blocker, 5-alpha reductase inhibitor, okay, AC inhibitor, aldosterone antagonist. All of you are saying what is that? Yes, the answer is BPH, BPH, BBBB. So you people are absolutely correct. What is that? 5-alpha reductase inhibitor. Okay, yes. So there are some important confusion points about BPH also. I will finish it off here only very quickly. Okay, B is the correct answer. Chalo, very good. 4, 2. बताओ और बताओ कितना बनेंगे? 2 बताने वाले, 4 बनेंगे, 2. So चलो, the answer is 5-alpha reductase inhibitor. It is not a calcium channel blocker. It is a 5-alpha reductase inhibitor. ठीक है, वो तुम ही जानते हो भाई कितना बनेगा, हमें क्या पता है. ठीक है, I don't know. Now listen to me. First important aspect. What is that? When we are speaking of BPH, BPH में काम कांड क्या होता है, दिक्कत क्या होता है? You have testosterone. You have testosterone. Okay, so now please listen to me. 4 पेग पता नहीं यार, हो सकता है. Okay, now listen to me. Testosterone, what happens under the influence of one enzyme called as 5-alpha reductase. Okay, please listen to me. Here only I will cover up a lot of things. BPH भी खत्म करेंगे. अच्छा, इतना strong. Okay, so listen to me. So what will happen? What I'm trying to tell you, testosterone के साथ साथ we will cover up androgenic alopecia and BPH also. दोनों एक साथ खत्म कर लेते हैं. So we'll write down the drug of choice, the investigations, everything together. Okay. चलो. So what will happen? Testosterone will get converted into 1,5 dihydroxy testosterone. 1,5 dihydroxy testosterone. Okay, so this 1,5 dihydroxy testosterone will cause hair loss. We will call it as a androgenic alopecia. Okay, androgenic alopecia में which pattern of hair loss? In the male, pattern of hair loss called as Hamilton pattern. Okay, acha, very good. Thank you for the details. Okay, so that is a dihydroxy testosterone. It will also go and stimulate the prostate gland, prostate growth. Okay, prostate growth, leading to what is that? Benign prostatic hyperplasia. Okay, so this benign prostatic hyperplasia, what will happen? The clinical features are your already hesitancy will be there. Okay, increased frequency of urination, hesitancy, and difficulty in urination. Okay, difficulty in urination. So when patient comes USG करके देखोगे, USG में क्या मिलेगा सर? USG करके देखोगे, so there is a increased size of the prostate, one change you are going to get, and one important point you should never forget called as post void residue. Post void residue means आफ्टर यूरिनेशन, मीन्स क्या होता है, यूरिनेशन के बाद में ब्लैडर के अंदर कितना अमाउंट ऑफ यूरिन विल रिमेन, सो हाउ मच अमाउंट ऑफ यूरिन विल रिमेन आफ्टर द यूरिनेशन, so that is only called as post void residue. So post void residue, if it is more than 100, ml, then it is suggestive of diagnosis of BPH, benign prostatic hyperplasia. Okay, and also we do one more thing, that is only PSA, prostate specific antigen serum, PSA also we are going to do. Okay, so the drug of choice is your 5-alpha reductase inhibitor, such as finasteride. The drug of choice is finasteride, that is your 5-alpha reductase inhibitor. किसको बंद कराता है? 5-alpha reductase को inhibit कर देता है. And one more thing, for the symptoms, the drug of choice is alpha 1A blocker called as tamsulosin. What is that? Tamsulosin. What is the name of the drug? Tamsulosin. If tamsulosin is not there, then we also use siledosin. What is that? Siledosin. Both of them are, we can use alpha 1A blocker for the treatment of only symptoms. Agar if BPH is there, if BPH plus hypertension is there, then we are going to use such as prazosin. We use drugs such as prazosin or toxazocin. Okay, so thank you so much. So prazosin and toxazocin. So prazosin कहाँ पे use करते हैं? Yes, scorpion bite. ठीक है? So चलो, then let's continue androgenic alopecia. भैया androgenic alopecia में भी दो तरीके होता है, topical and one more will be there, that is systemic. Okay, so topical में you are going to use minoxidil. क्या use करते हो? Minoxidil. Okay, minoxidil actually पता है ये minoxidil किस लिए बनाए थे? Minoxidil actually it was made as a potassium channel dilator for the treatment of hypertension. ठीक है, हाइपरटेंशन को यूज करते हुए हमें साइड इफेक्ट मिलने लगा कि हेयर ग्रोथ, एक्सेसिव हेयर ग्रोथ होने लगा. वी स्टार्टेड टू नोटिस एक्सेसिव हेयर ग्रोथ आफ्टर यूजिंग मिनॉक्सिडिल फॉर हाइपरटेंशन एज अ साइड इफेक्ट. सो देन वी थॉट, वाह, व्हाट अ स्ट्रेटजी, चेंज दैट, यूज इटसेल्फ, अप्लाई ओनली ऑन द हेयर, ग्रो योर हेयर. Okay, so that is why minoxidil came. And for the systemic use of androgenic alopecia, 5-alpha reductase inhibitor itself. Okay, so systemic treatment 5-alpha reductase inhibitor, and this one's your minoxidil is for the topical application. Actually minoxidil is as the antihypertensive. ठीक है, so समझ में आ गया? अब कोई गलत नहीं करेगा. बीपीएच के बारे में, फार्माकोलॉजिकल एस्पेक्ट ऑफ बीपीएच, नोबडी शुड मेक ए मिस्टेक. सीधी बात, देखो ड्रग ऑफ चॉइस पूछा है, सीधा फिनेस्ट्राइड 5-alpha reductase inhibitor. Okay, if he is asking symptoms को क्या मैनेज करे, alpha 1A blocker. If he is asking BPH with hypertension, सीधा मार्क करो prazosin या toxazocin. Usually among alpha blocker दो commonly पूछा जाता है, prazosin हो सकता है एग्जांपल में, या toxazocin होता है. और prazosin और एक जगह में भी काम आएगा, कहां पे सर? यस, कहां पे काम आएगा? स्कॉर्पियन बाइट में. चलो आगे बढ़ते हैं. ए पेशेंट प्रेजेंटेड विथ गाउट सिम्टम्स but forgot to mention asthma in the history. First day intern prescribed aspirin, later patient developed asthma symptoms and came to the emergency. Okay, so what is the drug of choice? So चलिए देखते हैं what is the drug of choice. क्या देंगे? बढ़िया बढ़िया, वेरी गुड. मिथाइल डोपा डोंट कंबाइन विथ मिनॉक्सिडिल. भैया आजकल के टाइम पे मिनॉक्सिडिल इज नॉट यूज्ड एज एंटी हाइपरटेंसिव. अगर इफ दे आर यूजिंग मिथाइल डोपा एज एंटी हाइपरटेंसिव, वी विल नॉट कंबाइन. प्रेग्नेंट फीमेल को बाल झड़ने का क्यों टेंशन है? मिथाइल डोपा ज्यादा के ज्यादा तरीका प्रेग्नेंट फीमेल में यूज करते हैं. आज वो भी बताऊंगा प्रेग्नेंट फीमेल में विच ड्रग्स आर यूज्ड आल्सो. चलो लेट्स कंटिन्यू. पेशेंट प्रेजेंट विद द गाउट सिम्टम, तो क्या हो गया? सो उसको बाद में आस्थमा आ गया, एस्पिरिन देने, एस्पिरिन ब्लॉक लॉक्स, एस्पिरिन इंड्यूस लॉक्स, प्रोस्टाग्लैंडिन इंड्यूस ब्रोंको कंस्ट्रिक्शन, नन ऑफ द अबव। चलो बता दो, आंसर बता दो, लेट्स सी। So Rinkesh says the answer is B, and Muhammad is saying the answer is D, and some people are saying answer is C. Muhammad again changed the answer to C. Okay, Rohan Raj C. Okay, Prince you are saying D. So answer is वेट करते रहो, पहले पढ़ते हैं एस्पिरिन का मैकेनिज्म, ठीक है। सो वी हैव ए केमिकल कॉल्ड एज अराकिडोनिक एसिड, अराकिडोनिक एसिड। दिस अराकिडोनिक एसिड फेलो क्या करता है, इन्हें नॉर्मल, पहले पढ़ते फिजियोलॉजिकल स्टेट में, इन्हें फिजियोलॉजिकल स्टेट, ओके। सो सम पीपल आर गारंटीली सेइंग इट इज सी। देखते हैं क्या आंसर आएगा। इन ए फिजियोलॉजिकल स्टेट व्हाट विल हैपन, सो दिस अराकिडोनिक एसिड अंडर द इन्फ्लुएंस ऑफ एन एंजाइम, ये मतलब अराकिडोनिक एसिड, अरे भैया इसको पूरा नाम लिख देते हैं, नाराज हो। Okay, arachidonic acid under physiological state, he will produce something called as prostaglandin E2 and also thromboxane A2. It will also produce thromboxane A2 by an enzyme called as COX. Okay, by an enzyme called as COX. Okay, by an enzyme called as COX. Okay, so now the next important aspect is that this arachidonic acid during inflammation, during which condition? During inflammation. Okay, so this during the inflammation, what will happen is that please listen to me, during the inflammation COX2 will come. COX2 will produce abnormal prostaglandin. What is that? Abnormal prostaglandins. Okay, so these abnormal prostaglandins will create fever, pain and inflammation itself. They will increase the inflammation. Okay, so this is one story of arachidonic acid. Now this arachidonic acid, sir, can enter into LOX pathway. Arachidonic enter into LOX pathway. It will produce something called as leukotrienes. Okay, so what happens with the leukotrienes? So please listen to me. These leukotriene fellows, they will lead to production of something. What is that? Stimulation of leukotriene receptors. यहाँ पे देखो, आज इसके अंदर at least 3 or 4 groups of drugs पढ़ेंगे हम लोग, ठीक है। Now this leukotriene receptor, when they are activated, they will cause bronchoconstriction. Okay, bronchoconstriction. So ये हो गया तुम्हारा स्टोरी। ओके, नाउ माय डियर स्टूडेंट्स, यहाँ पे देखो एस्पिरिन का मैकेनिज्म क्या है। एस्पिरिन का मैकेनिज्म, एस्पिरिन and other NSAIDs, all the NSAIDs, they will block the COX enzyme. They will block which enzyme? COX enzyme. कौन से enzyme को block करते हैं? COX enzyme. If COX enzyme is blocked, then what will happen? There is a decrease of PGE2. Yes, sir. There is a decrease of thromboxane A2. Yes, sir. And also decrease of abnormal prostaglandin. Yes, sir. If all of them are decreased, उससे अच्छी बात भी है, बुरी बात भी है। Abnormal prostaglandins कम हो गया। Abnormal prostaglandins कम हो जाएगा तो yes, it will treat. It is the treatment for yes, pain and fever, pain, inflammation, and also for fever. Okay, now prostaglandin E2 कम हो जाएगा तो क्या होगा? स्टोमक का प्रोटेक्शन नहीं रहेगा. It will lead to a problem. What is the problem called as? It will lead to a peptic ulcer disease. Okay, now aspirin क्या कर रहा है? Aspirin is blocking what is that? COX enzyme. If COX enzyme is blocked, automatically what will happen? More of arachidonic यहाँ पे देखो COX enzyme को तुमने बंद कर दिया. किसको बंद कर दिया? COX2 को and COX1 को. If you block the COX, now more of what is that? Yes, more of arachidonic acid goes into the LOX pathway. LOX pathway will cause bronchoconstriction. So answer will be what is that? Prostaglandin induced bronchoconstriction? No, it is not a prostaglandin induced? The answer is D, none of the above. None of the above. The answer is none of the above. Okay, so do not get confused. That is caused by leukotriene induced bronchoconstriction. It is a leukotriene induced bronchoconstriction. गलती मत करना. So when you block the COX enzyme, किसको block कर दिया है? COX. If you block the COX enzyme, more arachidonic acid will enter into the LOX pathway that can lead to bronchoconstriction. So that is why side effect caused by aspirin is your, that is very important effect. What is that? Yes, that is your bronchial asthma also. Okay, then we have one more drug, that is only LOX inhibitor. ये हो गया aspirin का कहानी. ये आगे बढ़ते हैं LOX inhibitor. LOX inhibitor again बहुत लोग confuse कर लेते हैं. So this LOX inhibitor is your Xeluton. What is the name of the drug? Xeluton. The name of the drug is Xeluton. Okay, then दूसरी होते हैं, the next one leukotriene antagonist. तो फिर अरे जहां पे ट्रैप है तो थोड़ा बहुत रहना पड़ता है. तो दैट इज व्हाट, ये देखो बहुत इंपॉर्टेंट एस्पेक्ट होता है. ओके, सो देखो ल्यूकोट्राइन एंटागोनिस्ट. इन्हीं को बोलते हैं वो एंटी ल्यूकोट्राइन्स. इन्हीं दिस ड्रग्स आर ओनली कॉल्ड एज anti-leukotrienes. These drugs are only, what is that? Anti-leukotriene drugs. यहाँ पे दो भाई लोग हैं, that is your Jafir Bhaiya and Monty Bhaiya. What are those? Jafir Lucast. What is that? Jafir Lucast and Monty Lucast. What is that? Monty Lucast. Okay, इसमें भी confuse मत करना. अगर कोई पूछेगा what is the mechanism of Jafir Lucast or Monty Lucast, गलती से भी मत बोलना LOX enzyme को block करता है. It is not blocking the LOX enzyme, rather it is blocking the leukotriene receptor. So anti-leukotriene drugs block the leukotriene receptor, not the enzyme. This is also a trap. This is also a very, very big trap. Anti-leukotrienes, they are blocking which one? They are blocking leukotriene receptor. They have nothing to do with the LOX enzyme. ठीक है, ये भी ऐसे ही मतलब खेल जाएगा एग्जामिनर. Be very, very careful. ठीक है, चलो आगे बढ़ते हैं. Next one. This is a very easy question, direct question. Come on, quickly tell me the answer. Which of the following is the drug of choice for the facial nerve palsy? Acyclovir, ceftriaxone, prednisolone and naproxen. बताओ. It's a direct answer. इसमें कोई ट्विस्ट नहीं है, टर्न नहीं है, गूगली बॉल नहीं है, सीधी क्वेश्चन. ठीक है, फुल टॉस बॉल, सीधा उठा के मारेंगे तो 6 बोल जाए. ठीक है, बट उसके लिए आंसर पता होना चाहिए. कोई दिक्कत है, पता नहीं तो गेस करो. चलो, so Pratisha says it is C. What about others? Come on guys, quickly tell me. चलो बताओ. What is the drug of choice for facial nerve palsy? Nikhil is saying C. Okay. So remember, facial nerve palsy, though it is involving the virus, you are not going to use your, what is that? Use your antiviral drugs. Rather, the drug of choice is prednisolone. The drug of choice is prednisolone. Okay, that is prednisolone. Very good, correct answer. All of you are absolutely correct. Okay, now यहाँ पे ऐसे नर्व के बारे में आ गए तो ड्रग ऑफ चॉइस फॉर ट्राइजेमिनल न्यूरोलजिया. ये भी इंपॉर्टेंट क्वेश्चन है. ट्राइजेमिनल न्यूरोलजिया का ड्रग ऑफ चॉइस बताओ. ट्राइजेमिनल न्यूरोलजिया patient will come with a shooting pain in the face, and trigeminal neuralgia patient का ड्रग ऑफ चॉइस क्या होता है? Any answer? Yes, then we are going for the next one, nerve decompression. We are going not direct for the nerve conduction, for what is that? For your, like, you are going to check for your decompression. Okay, so what is the drug of choice? Very good, the answer is carbamazepine. Okay, carbamazepine. Okay, what is the drug of choice? Carbamazepine is an anti-epileptic drug. Okay, so carbamazepine has one specialty. Remember, it will undergo some process called as, it will undergo auto induction. बस इतना याद रखो, auto induction on a long term use. Okay, on long term use. ऑटो इंडक्शन मतलब वो खुद अपना आपका मेटाबॉलिज्म बढ़ा लेते. इट विल इंक्रीज इट्स ओन मेटाबॉलिज्म. ओके, ये किसी और को भी परेशान करेगा, खुद को भी परेशान करेगा. ओके, दिस इज दैट टाइप ऑफ पीपल. ओके, मतलब मैं सुकून से नहीं रहूंगा और किसी और को भी रहने नहीं दूंगा. ओके, ना खेलेंगे ना खेलने देंगे, ऐसा वाली कहानी. So it will undergo metabolism, that is auto induction metabolism, and these drugs will also undergo increase the metabolism of other drugs. Okay, it is a enzyme inducer. Okay sir, so this is the story of your facial nerve palsy. Drug absolutely contraindicated in pregnancy is, answers are captopril, paracetamol, ranitidine, cefixime. बताओ भाई क्या आंसर है? Come on quickly. Drug absolutely contraindicated, देना ही नहीं चाहिए. Ranitidine, paracetamol, cefixime. It's a enzyme inducer. Very good. चलो आंसर बताओ. Captopril, paracetamol, ranitidine and cefixime. Okay, which is absolutely contraindicated. The answer is very good answer. The answer is captopril. Okay, so please remember captopril. Captopril is a drug which is having a teratogenic drug. It is a teratogenic drug. This is a teratogenic drug. This is a teratogenic drug. Very good, all of you are correct answer. Teratogenic drugs. So examples for teratogenic drugs: warfarin. There are a big list of drugs are there. Just a few of them जो मतलब repeatedly पूछ सकता है. Warfarin is teratogenic. Okay, phenytoin is teratogenic. Phenytoin is teratogenic. Valproic acid is teratogenic. Valproic acid is teratogenic. Okay, valproic acid, that is sodium valproate. ACE inhibitors are teratogenic. ACE inhibitors. Then ARBs. These are some drugs which are very dangerous to use in pregnancy. Warfarin, phenytoin, valproic acid, ACE inhibitor, ARBs. All of them are contraindicated in pregnancy. Okay. Then this paracetamol, yes, safe. Paracetamol is safe in pregnancy. All three of them are actually safe in pregnancy. Okay. Now, there are few drugs which I'd like to discuss. So safe in pregnancy, especially antibiotics which can be used in pregnancy. Hypertensive drugs के बारे में मैं बाद में बताऊंगा. Okay, hypertensive drugs I'll talk about later on. So the safe in antibiotics safe in pregnancy. Antibiotics safe in pregnancy are which ones? Okay, चलिए बताता हूँ, ध्यान से सुनो. One of them is your penicillins, my dear students. Yes, penicillins are very safe. Penicillins are very safe drugs in pregnant female. Then your, what is that? Cefixime, that is cephalosporins are also safe. Cephalosporins are also safe. Yes, okay, cephalosporins are also safe. And also your, what is that? That is your nitrofurantoin. Nitrofurantoin. Okay. So thank you so much, Vipin. Thank you. It means a lot. Thank you so much. So चलो आगे बढ़ते हैं. नाइट्रोफ्यूरेंटाइन, सेफेलोस्पोरिन एंड योर व्हाट इज दैट? पेनिसिलिन्स. ओके, सो ये सारे क्या है भैया? सेफ है. सो ऑलवेज रिमेंबर दिस ड्रग्स. ओके, सो जो सेफ है प्रेग्नेंट फीमेल में. ठीक है, चलिए आगे बढ़ते हैं. लेट्स गो टू द नेक्स्ट इंपॉर्टेंट. ओके, चलिए, look at this question. What is the treatment of choice in a 2-month pregnant female diagnosed with falciparum malaria? What is that? Falciparum malaria. Options are ACT, that is artemisinin combined regimen treatment. Okay, then doxycycline, quinine and IV artesunate. What is the treatment of choice for the pregnant female? Okay, so what is the answer? चलो बता दो. Wow, pregnant women also safe from husband. Wow, very nice. चलो आंसर बताओ. For the falciparum malaria. So Pratyusha says it is, answer is A. Okay, come on, tell me. Okay, so some people are saying what is that? That is A, and some people are saying C. The correct answer is, sir, C. What is, sir? C. The answer is what? C. Okay, what is that? C. Okay, so चलिए प्रेग्नेंट फीमेल के बारे में देखते हैं. फर्स्ट यहाँ पे वाइवाक्स के कहानी देखते हैं. Okay, then here we will look at the falciparum malaria. And फर्स्ट ट्राइमेस्टर में होगा तो क्या करेंगे? फर्स्ट ट्राइमेस्टर. ओके, अगर सेकेंड एंड थर्ड में है तो क्या करेंगे? ओके, अब ये होता है क्या सर इंडिया में? अरे बहुत कॉमनली आएगा ये सीन. ओके, सो व्हाट वी आर सपोज टू यूज. तो करेक्ट आंसर कौन है? क्विनिन है. ठीक है, सो फर्स्ट ट्राइमेस्टर अगर वाइवाक्स मलेरिया है तो वाइवाक्स डज रिस्पॉन्ड ओके ये कैसा हो गया, अब मैं मैजिक दिखाऊंगा ना, हाउ अभी समझाऊंगा ना। वाइवैक्स के अंदर वी कैन यूज व्हाट इज दैट, क्लोरोक्विन। What is that drug you can use? Chloroquine. Chloroquine, is it safe in pregnancy? Yes, chloroquine is safe in pregnancy. What is that? Chloroquine is safe in pregnancy. What is that? Chloroquine is safe in pregnancy. Okay. So for both Vivax के लिए it is sensitive to chloroquine. तो Vivax patient के लिए दे दो first trimester and second trimester both of them दे दो क्या? Chloroquine itself. What is the drug you are going to use? Chloroquine. Okay. Agar falciparum patient, if the falciparum patient comes, if it is first month, first trimester, then your quinine. What is that? Quinine. Quinine अकेले नहीं देते हो, rather quinine combined with clindamycin. Combined with what? Clindamycin. Combined with clindamycin. Falciparum malaria. What is that? Falciparum malaria. अगर second and third trimester में है तो what is that? ACT, artemisinin combined regime. Artemisinin combined with other drugs. Okay. For example, if it is cerebral malaria, if it is a cerebral or a complicated malaria, for the cerebral or a complicated malaria, again we are going to use ACT only. What is the drug used? That is ACT. Okay. So paraquin is contraindicated in pregnancy, absolutely contraindicated. Okay. So ये टेबल याद करके जाओ and Vivax अगर pregnant female के बारे में पूछ दिया तो लगा के आओ आंसर, कोई टेंशन नहीं, क्लोरोक्विन सेफ इन Vivax. कोई कंफ्यूजन, कोई दिक्कत नहीं? I hope no problems. Let's continue to the next point. Okay. So treatment for ventricular tachycardia. What is the drug of choice for the treatment of ventricular tachycardia? The options are verapamil, amlodipine, amiodarone, and atropine. Chalo batao, what is the drug of choice? So some people are saying answer is C. Okay. Others are like sir हमें अब आप ही बता दो आंसर, हम थक गए है ना. Okay, so somebody is telling B, Pratyusha, and Baisla is saying C. Muhammad Adil is saying B. Okay, so chaliye sir, according to the latest ACLS protocols, advanced cardiac life support protocols. Yes, what is that? Pradeep, Medico, Bhavesh, all of you are correct. What is that? Amiodarone. What is a drug? Amiodarone. Okay, so when we are speaking of amiodarone के बारे में itself has have a lot of question and also drug of choices. Okay, पहले ventricular tachycardia के बारे में देखते हैं. Okay, now let's look at the ECG. Okay, so we have something called ventricular fibrillation. What is that? Ventricular fibrillation. अब ध्यान से सुनो, ये बहुत confusing भी है and easy भी है. I'll just explain it off once, आपको समझ आ जाएगा. सर कंफ्यूजन ही कंफ्यूजन, आज भगा देंगे कंफ्यूजन को, टेंशन ना लो, पूरा ईसीजी से लेके स्टेप बाय स्टेप समझा, मैं हूं ना यहाँ. ओके, वेंट्रिकुलर फिब्रिलेशन इज आल्सो कॉल्ड एज पॉलीमॉर्फिक क्यूआरएस भी बोल सकते हो, वेंट्रिकुलर टैकीकार्डिया भी बोल सकते हो. ओके, So listen to me, what will happen? So what will happen is that polymorphic ventricular tachycardia. So polymorphic ventricular tachycardia में ECG दिखेगा तुम्हारा ऐसा कुछ. Okay, so क्या सर? So ventricles, दोनों ventricle ऐसा contract करना चाहिए, but instead of that dadang 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 करके dance करने लगेंगे. So when they start to dance, every time they're dancing like this, okay, they're dancing like this, ये QRS बनेगा. थोड़ा dance हुआ QRS, थोड़ा dance हुआ QRS, but पूरा QRS बनेगा? No. So because of this dance, what will happen? Yes, what will happen is ऐसा abnormal ECG मिलेगा. ठीक है, अगर वही चीज वो बोलेगा ventricular flutter, which is also called as monomorphic ventricular tachycardia. Okay, so monomorphic matlab same shape. Okay, so they will get only QRS like this. Okay, matlab एक ही shape का होता है. So there is no rule that एक ही design matlab same matlab ऐसे ही design आएगा. So shape might be changed, but one QRS to another QRS compare करोगे same रहेगा, उसी को बोलते हो monomorphic ventricular tachycardia. So whenever you get this condition, the treatment of choice, drug of choice for ventricular tachycardia is your your amio drug, but before going to the drug of choice, पहले आप करना क्या चाहिए? Yes, you are going to use a defibrillator. What is that? Defibrillation. Okay, defibrillator you are going to apply. Defibrillator के बाद first drug of choice is your amiodarone. What is that? Amiodarone. Okay, but if it is digoxin induced, what is that? Yes, digoxin induced ventricular tachycardia. मतलब digoxin के वजह से अगर ventricular tachycardia or ventricular fibrillation, ventricular tachycardia, it can be monomorphic or polymorphic. So it can be monomorphic or polymorphic, that is your induced ventricular tachycardia. Amiodarone is contraindicated. Amiodarone is not used. The drug of choice क्या बनेगा? Then the drug of choice is lidocaine. Then the DOC is very good answer. The drug of choice is lignocaine. What is that? Lignocaine. Okay, lignocaine is also called as lidocaine. Okay, so यहाँ तक सबको समझ में आ गया? अब पूरा वो, if they ask you with the ECG also, a patient is unconscious with the following ECG, what is your next step of management? कुछ नहीं है भैया, ले लो डिफिब्रिलेटर, जल्दी बुलाओ, क्या करो, CPR लग जाओ, डिफिब्रिलेशन मतलब शॉक देने लगो, उसके बाद जल्दी जल्दी रेडी रखो कौन? अमियोडारोन. ओके, देन अगर वो उसका हिस्ट्री तुम्हें पता था कि if is using what is that, that is your, for example, what is, if digoxin के ले रहा था, then the drug of choice is lidocaine. Okay, defibrillator can be used in both male and female. हाँ, उसमें क्या है? Okay, yes, you can use it in both patients. Okay, all right, then we are finished with this. Amiodarone, ये भाई साहब का साइड इफेक्ट भी बता देता हूँ. अमियोडारोन का साइड इफेक्ट, अमियोडारोन का साइड इफेक्ट भी बहुत बार पूछा जाता है. It will cause what are those? Pulmonary fibrosis. Okay, it will also cause what is that? Most importantly, hyperthyroidism or hypothyroidism. Hyper or hypothyroidism, both of them can occur, hypo and hyperthyroidism. Okay, then it can lead to pulmonary fibrosis. Okay, and also it can lead to corneal precipitate. क्या बनाता है? Corneal precipitates. Okay, and also it will lead to what is that? That is one of the most important, that is peripheral neuropathy. ठीक है, ये सारे आता है पेशेंट को. ठीक है, बट ये पेशेंट में गायनेकोमेस्टिया आएगा कि नहीं आएगा? अमियोड्रान हैज नो गायनेकोमेस्टिया. ये भी पॉइंट याद रखो. No gynecomastia. Gynecomastia causing drugs are totally different. All of you know them. That is disco drugs. कौन से drugs है वो? Disco drugs. Okay, and also your blue man syndrome. Add that also, blue man syndrome. So this is the story. Then mechanism of action. इतना बड़ा दिया, mechanism of action क्यों ना पढ़ा है भाई? Amiodarone is a class 3 antiarrhythmic drug. Is a type of class 3 antiarrhythmic drug. It will act by inhibition of potassium channels. It acts by inhibition of potassium channels on your heart. ठीक है सर? Periphery of my lung cornea is photosensitive. बहुत पुराना निमोनिक. Yes. Okay, चल. वेरापामिल कब यूज करेंगे और अदर ड्रग्स कब यूज करेंगे? चलिए देखते हैं. एट्रियल फिब्रिलेशन के लिए you are going to use calcium channel blockers such as verapamil, which is equally effective to that of beta blocker. याद रखो, calcium channel blockers and beta blockers are equally effective. Okay, yes, I already told you pulmonary fibrosis. Atrial fibrillation, what is the drug of choice is? What is that? Calcium channel blockers and beta blocker. If the patient is with atrial fibrillation with COPD or asthma, okay, asthma, then the drug of choice is your CCBs, calcium channel blockers. Okay, confuse मत होना. With COPD or asthma है तो drug of choice is calcium channel blocker. If सिर्फ atrial fibrillation, when any one of them is a correct answer. Okay, then amlodipine तो यहाँ पे यूज ही नहीं करते. amlodipine is used in the treatment of hypertension. अब atropine कहाँ पे यूज करते हो सर? atropine is a drug of choice for AV block. Atropine is a drug of choice for AV block. Okay, verapamil is a CCB. ठीक है, कोई कंफ्यूजन? यहां तक सब समझ में आ गया? अब कोई गलत करोगे? Ventricular fibrillation, atrial fibrillation, when to use defibrillator for ventricular fibrillation, okay, and your pulmonary fibrosis done, pulmonary fibrosis and other side effects of amiodarone, okay. So hopefully you understood everything. चलिए आगे बढ़ते हैं. बोला ना least associated side effect, ये last year पूछा था शायद. Sorry. लीस्ट एसोसिएटेड विद amiodarone, मतलब बहुत कम amiodarone के साथ कौन सी साइड इफेक्ट आता है. चलो इसका आंसर बता दो. बस अब नहीं करना चाहिए गलती. बस ब्रैडिकार्डिया एंड एवी ब्लॉक, डेफिनेटली करेक्ट आंसर. चलो नेक्स्ट क्वेश्चन के लिए क्विकली बता दो. ए लीस्ट एसोसिएटेड साइड इफेक्ट ऑफ amiodarone, ऑप्शंस आर हाइपोथायराइडिज्म, हाइपरथायराइडिज्म, पल्मोनरी फाइब्रोसिस एंड गायनेकोमेस्टिया. कौन सी साइड इफेक्ट नहीं आएगा? चलो पीछे तो देखो, पीछे तो देखो, यहाँ पे लिखा हुआ है, ध्यान इतना बड़ा लेटर्स में. व्हाट इज दैट? लीस्ट एसोसिएटेड विद amiodarone इज गायनेकोमेस्टिया. डी 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 डी, आंसर इज डी, गायनेकोमेस्टिया. ठीक है सर. चलो आगे बढ़ते हैं. नेक्स्ट क्वेश्चन. Patient has ptosis worsening by evening, was diagnosed with myasthenia gravis. What is the drug of choice for myasthenia gravis? What is the drug of choice for myasthenia gravis? बता दो भैया, जल्दी बताओ. Options are pyridostigmine, prednisolone, cyclosporin and plasma exchange. Yes, come on guys, quickly. Pyridostigmine, that is your prednisolone, and cyclosporin and plasma exchange. So all of you are telling what is the drug of choice for myasthenia gravis? Yes, the answer is your pyridostigmine. Very good answer, sir. What is that? Pyridostigmine. What is that? Pyridostigmine. Okay. Now when we are speaking of pyridostigmine, तो पूरा myasthenia gravis quickly एक बार repeat करा दूंगा आप लोगों को ताकि confusion ना हो. myasthenia gravis में किस चीज के वजह से आता है? There is a autoantibodies to which receptor? To the NM receptor. To which receptor? NM receptor. तो ये एक नरु था. ठीक है. Here is the muscle, here is the muscle. Okay, here is the muscle. एंड यहाँ पे क्या है? NM receptor है. NM receptor. So यहाँ पे क्या होता है? What will be released? Acetylcholine will be released normally. Normally acetylcholine will act on the NM receptor, and acetylcholine is metabolized by an enzyme called acetylcholine esterase. What is that? Acetylcholine esterase into acetate plus choline. So normally acetylcholine release होता है. वो कहाँ पे act करता है? It will act upon the myasthenia, sorry, NM receptor. NM receptor. Later it will be metabolized into acetate and choline by your acetylcholine esterase. Okay. So the next important aspect. So now what will happen in the patient with myasthenia gravis? What will be there? There will be autoantibodies. Antibodies to whom? Antibodies to the NM receptor. Autoantibodies to the NM receptor. Now both of them are trying to bind to that receptor. Both of them. कौन? Acetylcholine भी बोलता है अरे भैया तू तो मेरा दोस्त है. NM receptor will tell, hey come on man, you are with me now. Okay. So like that fight is happening. Okay. So if fight is happening, then what is the diagnosis? What is the diagnosis? Diagnosis कैसा बनाओगे? Diagnosis is done with the help of multiple tests होते हैं. Okay. We can check for autoantibodies. Okay, we can check for nerve conduction studies, and also we can check for one important test, that is a tensilon test. What is that? Tensilon test. क्या करते हो? Tensilon test. So tensilon test में क्या देते हो? एड्रोफोनियम. क्या देते हो? एड्रोफोनियम. क्या देते हो? एड्रोफोनियम. क्या देते हो पेशेंट को? एड्रोफोनियम. एड्रोफोनियम कितना दोगे? 10 mg. ओके, 10 mg. एक कौन सी ड्रग होता है? शॉर्ट एक्टिंग and also anticholine esterase. Anticholine esterase मतलब ये एंजाइम को इनहिबिट करने वाला. ओके, so now listen to me. Anticholine esterase. So now tensilon test, एड्रोफोनियम दोगे. Immediately after giving the एड्रोफोनियम क्या हो गया? Improvement of the symptom. उसको symptoms जो भी था, improve the symptoms. Improvement of symptom. Improvement of what? Symptom. Improvement of symptom. Symptom तो improve हो गए. Okay. So then that is only diagnosis of myasthenia gravis. अगर symptom improve होता है, diagnosis of myasthenia gravis. अगर symptoms not improve, it is likely, if that does not improve, likely it is caused by what? Likely caused by your cholinergic crisis. We call it as a cholinergic crisis. cholinergic crisis. So actually cholinergic crisis. Okay. So nowadays we don't use it clinically. Actually, it's not used. Okay. Now listen to me. The cholinergic crisis. Nowadays we don't do that much. Only for differentiating cholinergic crisis we might use adrophonium, but diagnosis of myasthenia gravis, no, we don't use adrophonium anymore. Okay. तो अब ट्रीटमेंट क्या करेंगे? ड्रग ऑफ चॉइस. ट्रीटमेंट क्या होता है? ट्रीटमेंट इज एंटी कोलिन एस्टरेज. Anticholinesterase. For what? Diagnosis of myasthenia gravis. Anticholinesterase. Anticholinesterase drug वो भी कौन सी? लॉन्ग एक्टिंग वाला एंड विच डज नॉट क्रॉस द ब्लड ब्रेन बैरियर. क्योंकि ब्रेन के अंदर तो कोई मसल नहीं. इनसाइड द ब्रेन देयर इज नो मसल. ओनली इन द पेरिफेरी यू हैव अ मसल. सो these muscles, if they have to work, what we are supposed to understand? So we need to use a anticholinesterase drug. So the first line drug of choice, anticholinesterases are the drug of choice. That is your pyridostigmine. Pyridostigmine. If pyridostigmine is not given in the option, you can mark neostigmine also. Neostigmine also. Okay. So this is a story of your, what is that? Story of your myasthenia gravis. और क्या है सर? सर ये भी तो यूज कर सकते हो ना. Why don't we use prednisolone and cyclosporin? Prednisolone and cyclosporin can also be used, right? Because they are suppressing the immune system. तो auto antibodies नहीं बनेगा. Auto antibody नहीं बनेगा तो yes, definitely we can use that. But remember, they are used only if no response. If no response to what? No response to pyridostigmine. No response to pyrido, then we are going to use prednisolone and cyclosporin. And plasma exchange is done only during, what is that? Cholinergic crisis. कहाँ पे यूज करते हो? Cholinergic crisis में यूज करते हो. So this is the story of your myasthenia gravis. And इसके अंदर you are definitely, they are going to definitely get, what is that? We are going to get one question, so do not get confused. Okay, समझ में आ गया? पूरा clear? So what is a story of your myasthenia gravis? Yes, सारे के सारे important. Sir, when we use oxime, so remember oximes are used in carbamate poisoning. Sorry, not used in carbamate poisoning. Organophosphate poisoning में oximes को use करते हो, but only if it is carbamate poisoning आपको use नहीं करना चाहिए. What is that? Oximes को. Oxime do not use in carbamate poisoning. They are used in other organophosphate poisoning. Okay, so I hope I cleared your doubt, Vishal Singh Rathod. I'll continue to the next important aspect. Let's go to the next question. A pregnant mother who is known case of asthma she's a known case of bronchial asthma, having a blood pressure of 160 by 102. The drug of choice in this condition is labetalol, nifedipine, thiazide, propranolol. Chalo sir, bata do answer, batao. So there are 4 drugs and she's a pregnant female. Okay, so क्या करना चाहिए? Labetalol, nifedipine, thiazide, propranolol. So come on, quickly give me the answer. What is the answer? Labetalol hai, nifedipine hai, thiazides, and your, what is that? Propranolol. All of you are telling it is a B. Okay. So in a normally drug of choice for your, what is that? Pregnant female with bronchial asthma, without bronchial asthma. For the pregnant female, पहले देखते हैं for the pregnant female. Of course, we were labetalol. Which drugs are the drug of choice? Use normal pregnancy with hypertension. The drug of choice is labetalol. But if the pregnant female has pregnancy, hypertension, along with that she is also having one more disease, that is your bronchial asthma. Then labet is not used. What is not used? Labetalol is not used. Okay, so it is not used. Then the best drug here will be nifedipine. So in the pregnant female, safe is, what is that? Nifedipine. Okay, so why? Because labetalol will also cause the bronchoconstriction. So antihypertensive drugs which are used in the pregnant female, safe in pregnant female. So first one is labetalol, safe in pregnant female, labetalol. Okay, methyl dopa, that is your alpha methyl dopa. Okay, Then you can also use, what is that? Yes, can anybody tell me any other drugs? That is your calcium channel blockers such as nifedipine. What is that? Nifedipine. Okay. Then what is that? Then you can also use prazosin. Okay. Then also you can use a hydralazine. Okay, so these are the drugs which are, what is that, which are safely used in pregnancy. Okay, so labetalol will cause what? If you use a labetalol can cause bronchoconstriction. So that is why in this case we are not giving that lady labetalol. Okay, so how to remember this? Let me care pregnancy hypertension. Okay, so this is a let me care pregnancy hypertension is a mnemonic to remember. What is that? Remember your, what is that, drugs which are safe in pregnant female with hypertension. So the drugs are your L for labetalol, M for methyl dopa, C for CCB, C for CCB, RCB नहीं है CCB है, ठीक है. P for pregnancy, P for prazosin, H for hypertension, H for hypertension. Okay, so this is a technique to remember. What is that? Pregnant females safe drugs in hypertension. Okay, चलिए आगे बढ़ते हैं. Let's go to the next question. Hope this much is clear for you. चलो, let's go to the next important question. Okay, so a patient after consuming alcohol started experiencing vomiting, abdominal pain and chest pain. On examination, patient was also having hypotensive. What drug can cause these symptoms? Okay, so the options are cefeprazone. Okay, then we have propranolol, calcium channel blocker and a pantoprazole. Okay, चलो बताओ. When RCB will win the cup, यार मैं बैंगलोर में बैठा हूँ तो मुझे पता होता है दर्द क्या है. तुम मतलब पूछो मत, मैं इसको निकालना ही नहीं चाहिए था. मुझे भी समझ नहीं आता. Even I don't understand. So come on, guess the answer. So some people are saying answer is C, some people are saying answer is A. Okay, so the answer is, yes, the answer is your first answer is A है कि नहीं है देखने के लिए क्या चाहिए? आफ्टर ड्रिंकिंग अल्कोहल इसको हाइपोटेंशन तक हो गया. व्हाट हैज हैपेंड? हाइपोटेंशन तक हो गया. सो दिस इज अ disulfiram like reaction. What is that? Disulfiram like reaction. Okay, it is a disulfiram like reaction. So what drugs? Disulfiram like reaction is immediately aversion which is produced towards the alcohol. Aversion produced towards the alcohol immediately after drinking the alcohol. So the answer is so that is your, yes, what is that? Cefeprazone. The answer is cefeprazone. Okay, so what is that? Cefeprazone. Okay, so disulfiram like reaction is caused by your metronidazole. Okay, then you have your cephalosporin such as cefoperazone. Okay, then you can also get because of cefotitan. Okay, cefiperazone, cefotitan. Okay, and also there is one more drug called as cefamendol. What is that? Cefamendol. So that is all three of them, all four of these drugs. Thank you so much. So all four of them क्या करवाता है? डाइसल्फिराम लाइक रिएक्शन. भाई दारू पीने के बाद ना दारू एंड एफएमजीए. आज हम अभी 1 मिनट के अंदर फटाफट से बता देते, तो दारू एंड एफएमजीए एग्जाम क्या होता है. ठीक है, यस इट वाज ए पीवाईक्यू. तो दारू के बारे में कहां क्वेश्चन आता है? पहले फार्माकोलॉजी में डाइसल्फिराम लाइक रिएक्शन इज कॉज्ड बाय अल्कोहल. अल्कोहल से क्या होता है? डाइसल्फिराम लाइक रिएक्शन. सो डाइसल्फिराम लाइक रिएक्शन मतलब ये ड्रग्स को कंबाइन करके लोग अगर इनटेक करोगे, डेफिनेटली यू आर गोइंग टू गेट व्हाट इज दैट? That is disulfiram like reaction, hypotension. ठीक है, that is one thing. Okay, alcohol के साथ we are absolutely we don't advise antibiotics. That is second one. Alcohol का the methyl alcohol का overdose, ethyl alcohol and are also we can use famiprazole. And for example, if the patient is having a methanol overdose, we can use ethyl alcohol or famiprazole. For ethyl alcohol overdose, famiprazole is the drug of choice. ठीक है, अब चलते हैं थोड़ा सर्जरी की तरफ. सर्जरी में पेशेंट विल ड्रिंक ए लॉट ऑफ अमाउंट ऑफ अल्कोहल, सडनली वॉमिट होता है. ये 10 साल का अल्कोहलिज्म एक कुछ कुछ वो सब हटा दो. अगर पेशेंट ड्रिंक्स लॉट ऑफ अल्कोहल, बिंज ड्रिंकिंग एंड सडनली वॉमिट्स, एंड उसके बाद चेस्ट पेन and which is radiating towards your left arm, chest pain radiates to the left arm, and subcutaneous emphysema, we call it as macular striate. ये दिखता है आपका कौन सी चीज में? spontaneous esophageal rupture called as Bori-Harvey syndrome. ओके अगर वॉमिटिंग होते हुए गैस्ट्रोइसोफेजियल जंक्शन में ब्लीडिंग आएगा तो बोलते हो मैलरी विस्टेर. मैलरी विस्टेर इस गैस्ट्रोइसोफेजियल जंक्शन में टेर होना. ठीक है, ये सारे के सारे डेफिनेटली एफएमजी के एग्जाम के अंदर क्वेश्चंस है. एंड एफएमजी विद ऑल रिस्पेक्ट टू अल्कोहल इज ओवर. ठीक है, अरे अब उतारने देते, देखते कैसे उतार देंगे. अरे हम, तुम क्यों टेंशन ले रहे हो? अल्कोहल इज डन फॉर योर एफएमजी का इंपॉर्टेंट क्वेश्चन में से. ठीक है, सो प्रोप्रानोलोल कैल्शियम चैनल ब्लॉकर पैंटोप्राजोल डज नॉट कॉज एनी ऑफ योर, व्हाट इज दैट, एनी ऑफ योर, वेरी इंपॉर्टेंटली दैट इज डाइसल्फिरम लाइक रिएक्शन. मेट्रोनिडाजोल, सेफेपेराजोन, सेफोटिटान एंड सेफेमेंडोल, दीस आर द ड्रग्स व्हिच कॉजेस डाइसल्फिरम लाइक रिएक्शन. ठीक है सर, चलिए आगे बढ़ते हैं. लेट्स गो टू द नेक्स्ट क्वेश्चन. व्हाट इज द मैकेनिज्म ऑफ एक्शन ऑफ thiazide diuretics? What is the mechanism of action of thiazide diuretics? Okay, so all the diuretics act in the nephron only. So before going into the mechanism of action of all the diuretics, so let's talk about sodium and chloride symporter inhibition in the DCT. Okay, sodium and chloride symporter activation in the DCT, sodium chloride transporter in the thick ascending limb, and osmosis. Okay, so ये सब आज clear कर देंगे, but you people tell me the mechanism first, then I will clear it up. You are telling answer is B. Okay, so it is, say you are telling activation of symporter in DCT, right? B. अच्छा दोनों भैया, ये क्वेश्चन का एडिटिंग भी तो मैंने करी है, ये भी तो एक बार देखो. दोनों जगह डीसीटी है, ध्यान दो सर. एक्टिवेशन इनहिबिशन दोनों डीसीटी है, ध्यान दो. आप लोगों को पता है एक्टिन डीसीटी रट के मतलब रटवा दिए थे, बट द थिंग दिक्कत है कि एक्ट कैसा करता है, एक्टिवेट करता है, इनहिबिट करता है. ठीक है, उसको छेड़खानी हमने भी करी है तो थोड़ा बहुत हो जाता है. सो ट्रैप ध्यान से देखो. ट्रैप इज, व्हाट इज दैट इज योर आंसर इज ये इज द करेक्ट आंसर. ओके, सो द करेक्ट आंसर इज ये. Okay, the correct answer is ये. very good, all of you are absolutely correct. Okay, so चलिए the diuretics का क्या है, INI सेट में भी पूछा था, तो क्यों रिस्क लेना है? रिस्क बिल्कुल नहीं लेना है बाबू भैया. तो डायूरेटिक्स, पूरा डायूरेटिक्स इन 2 मिनट. व्हाट टू रिमेंबर, लाइक मैकेनिज्म्स एंड साइट ऑफ एक्शंस, इन 2 मिनट्स वी विल अंडरस्टैंड. क्विकली देखो. all the diuretics will increase the urine output. Rule number 1, all the diuretics will increase the urine output. Okay, so they will increase the urine output by increasing of loss of sodium. Okay, so when we are speaking of diuretics, we have 5 groups of diuretics. So today we will learn about all the 5 groups, what is their mechanism and where is the location of action, and this is very important. So you have your PCT, you have your loop of Henle, that is thick ascending limb of loop of Henle, you have your distal convoluted tubule, and you have your collecting. Okay, so when we are speaking of these things, let's talk about what is that, what are the drugs and how do they work. Let's understand about it. Okay, so in the loop of Henle, about 25% of the sodium is reabsorbed. Okay, so we will write site. Okay, wait, first let's write the group, which diuretic. So which diuretic, okay, and कहाँ पे action करता है, site and mechanism of action. ठीक है, so let's talk about one by one. ठीक है, you have your loop diuretic. Loop diuretic act in the thick ascending limb of loop of Henle. Where it will act? Thick ascending limb. Okay, thick ascending limb. Okay, very good answer. All of you are absolutely correct. Okay, so thick ascending limb, ये क्या करता है? It will inhibit sodium, okay, to chloride potassium pump. Okay, symporter. Okay, Okay, so because of that, it will cause the loss of all the three ions, potassium, chloride, and sodium. So hyponatremia, hypokalemia, and hypochloremia are the side effects by your loop diuretics. Okay, loop diuretics are useful in emergencies like pulmonary edema. ओके, पल्मोनरी एडेमा में ड्रग ऑफ चॉइस लूप डायरेटिक, उसके अंदर एक लूप डायरेटिक है फ्यूरासमाइड, इट इंक्रीजेस द पॉसिबिलिटी ऑफ ओटोटॉक्सिसिटी. ओके, सब कुछ बता दिया हूं, ध्यान से एक बार सुन लो, एक बार रिवाइज हो भी जाएगा. ओके, thiazides, thiazides act in the DCT, distal convoluted tubule. They will inhibit sodium and chloride symporter, sodium and chloride symporter. Okay, so these will also cause the loss of potassium. Okay, though it is blocking only sodium and chloride pump, still it will cause the loss of potassium from the collecting duct. इतना याद रखा करो, from the collecting duct. Okay, potassium, sodium, and also your chloride, all three of them will be lost, and also they will cause one more side effect, gout. Okay, mechanism of action, side effect is gout. Okay, where do we use loop diuretics? Loop diuretics are the drug of choice in the treatment of diabetes insipidus at a nephrogenic level, and also importantly remember they are the first line management in a hypertension patient. Okay, thiazide ho gaya sir. Then carbonic anhydrase inhibitor, what is that? Carbonic anhydrase inhibitor. Carbonic anhydrase inhibitor act in the proximal convoluted tubule, and they will inhibit, what is that? A carbonic anhydrase enzyme, and they will cause the loss of, what is that? Yes, loss of HCO3 minus. They will cause the loss of HCO3 minus. HCO3 minus, if it goes in the urine में क्या चला गया? HCO3, what is it? Acid or base? Yes, it is a base. If base goes out of the body will become acidic. So what will happen? Side effect, the patient will have metabolic acidosis. बस बात खत्म. Metabolic acidosis. Okay, then we have osmotic diuretics. Where do they work? Majorly you can call it as all over the nephron, but mainly in the loop of Henle. Loop of Henle is the main site is loop of Henle, but also in the other places, okay, it works by osmosis. Okay, and these are osmotic diuretics are the drug of choice. अगर नहीं तो ऑस्मोटिक डायरेटिक का साइड इफेक्ट समझ लेंगे आप लोग, इसलिए. Okay, osmotic diuretics, these are drug of choice in increased intracranial pressure. अगर इंट्राक्रेनियल प्रेशर बढ़ गया तो क्या होता है? ऑस्मोटिक डायरेटिक को यूज करोगे. दे आर नॉट यूज्ड इन pulmonary edema, and their drug of choice in increased ICP, that is cerebral edema. ठीक है सर. The last group of diuretics, potassium sparing diuretics में एक होता है aldosterone antagonist. They will work in the collecting duct. Okay, and they block aldosterone receptor. Okay, and remember they will cause the loss of sodium, but no loss of potassium, इसीलिए उसको यूज करते हो. And that is spironolactone is the drug of choice. That is your drug which is there. Yes, they're acting in the collecting duct. We have a spironolactone. They are the drug of choice in Conn syndrome. They're also used in chronic heart failure. They're used for combination with other diuretics. And spironolactone fellow will cause, spironolactone को मैं बोल के भेज देता हूँ, ठीक है, जाओ भैया ब्लॉक करो, you block only aldosterone receptor, but this stupid fellow went and blocked testosterone receptor also. So that's how we found out it is also having a anti-testosterone, blocker of testosterone receptor. So the drug which is causing side effect gynecomastia among the diuretic is your spironolactone. Okay, no loss, they can even lead to hyperkalemia. Then there is one more called as ENaC blocker. Again, ENaC blocker, they work in the collecting duct only. They block epithelial sodium channels. We have drugs like amyloid and triamterene. Especially amyloid has what is that? Yes, the useful effect in the patient with nephrogenic diabetes insipidus caused by which disease? Caused by usage of lithium. Koi confusion, sir? Koi confusion? Okay. A female had an unprotected sexual intercourse and no more than 5 days have passed. She fears getting pregnant. What is the contraceptive of choice? What is the contraceptive of choice? Options are intrauterine contraceptive device, oral contraceptive pills, levonorgestrel, and or none of the above. What is the drug of choice we are going to use? Come on, tell me. It is already ध्यान दो यहाँ पे more than 5 days, more than 5 days. हाँ मतलब आराम से रह गए so they are not taking care of themselves, so that is already 5 days. Okay, so if earlier we could have given OCPs, okay, within 72 hours we can give OCPs, oral contraceptive pills, that is levonorgestrel. If less than 72 hours only. यहाँ पे कितने दिन हो गया सर, कितने दिन हो गया? 5 दिन से ज्यादा हो गया. ठीक है, so the best answer you can answer is intrauterine contraceptive device. Only thing what you can do is more than 5 days intrauterine contraceptive device. If it is levonorgestrel, only if it is less than 72 hours. Okay, what is the dose of levonorgestrel? डोज कितना देना चाहिए? So for yes, less than 72 hours, emergency contraceptive pills. सर मिस्ड विल वाला कॉन्सेप्ट बता दो. मिस्ड विल वाला कुछ नहीं है, अगर पिल मिस करोगे अर्लीस्ट पॉसिबल जब याद आएगा तब लेना है बस. उसमें क्या कंफ्यूजन? अगर पिल मिस हो गया अर्लीस्ट पॉसिबल ले लो अगले दिन. ओके चल. व्हाट इज अ डोज? Uliprostol up to 5 days but not available in India. Exactly, that is a problem. Very good. 1.5 what kilos grams mg, 1.5 mg. Okay, so intrauterine contraceptive device. So chaliye next one we will go. All FMGE very नो वेरी वेल सर. भाई देखो तुम्हें क्या लगता है यहाँ पे कुछ कम रहता है लोगों का? हर जगह पे सबको पता होता है ये. कहीं एक दो मिल जाते हैं ऐसे लोग 5 दिन तक कुछ मतलब केयर नहीं किए, ऐसे रह गए. ओके सो you have to be very very careful. Okay, चलिए आगे बढ़ते हैं. A patient was given 0.5% bupivacaine for a brachial plexus block. After some time the patient developed hypotension and arrhythmia. What is the best management for this condition? So he is having a overdose of what is that? Yes, hypotension and arrhythmia caused by what? Bupivacaine. So bupivacaine is a local anesthetic. Local anesthetic has become a overdose. What is the treatment of choice for this condition? So this is a very important PYQ. This has been repeated a lot of time. Okay, so what is that? 20% intralipid. So cardiopulmonary resuscitation, amiodarone and nifedipine. What is the drug of choice? Jaldi batao. Come on, tell me the answer. So you have कुछ तुक्का करो. अगर आंसर पता नहीं है कोई दिक्कत नहीं, तुक्का मारो. Just take a guess, wild guess. उसमें क्या गलती? Okay, tell me the drug of choice in this case. So Medico says answer is A. So remember it is a local anesthetic overdose. For all the local anesthetics, systemic toxicity. For local anesthetic, systemic toxicity, the treatment of choice is 20% intralipid. Directly याद रखो intralipid. What is the drug of choice? Intralipid. What is the drug of choice? Intralipid. Okay, so amiodarone कहाँ पे यूज करते हो? Ventricular arrhythmia में. Ventricular arrhythmia में. Nifedipine is used in hypertension. Nifedipine कहाँ पे? Hypertension. So local anesthetic का overdose का drug of choice is intralipid. Sir, what is that? Intralipid. चलो आगे बढ़ते हैं. The choline ester resistant to both true and pseudo choline esterase is the methacholine, bethanacol, बेंजाइल कोलिन, ब्यूटराइल कोलिन. ये आंसर पता नहीं तो डरो मत. ये प्रीवियसली पूछा हुआ क्वेश्चन नहीं है. नॉट ए पीवाईक्यू. इट इज जस्ट ए क्वेश्चन एडेड बाय मी. ओके, नॉट ए पीवाईक्यू. डरो मत. ओके सर ये तो कभी पढ़े नहीं थे. इट इज नॉट ए पीवाईक्यू. डू नॉट वरी. जस्ट फॉर यू पीपल टू टेल सम फैक्ट आई हैव एडेड द क्वेश्चन. डरो मत. ठीक है. सो वी हैव methacholine, bethanacol and benzyl choline, butyryl choline, among all of which is resistant to both true and pseudo cholinesterase is bethanacol. Bethanacol is resistant for both of them. Okay, bethanacol is usually resistant for both of them. So this is a fact. याद रखो bethanacol. Okay. चलिए, let's go to the next one. Actions of pilocarpine include all of the following except. Okay. So that is sweating, salivation, meiosis, and cycloplegia. चलिए, what is the actions of pilocarpine? हाँ, बस तुक्का ही लगाना है, ऐसा कोई दिक्कत नहीं. ओके, अगर क्वेश्चन आता है तुम कभी सुने नहीं हो तो करोगे क्या तुम भी? यार तुक्का मारना ही पड़ेगा, उसमें क्या गलती. Actions of pilocarpine include all of the following except. चलो आंसर बता दो. So pilocarpine is what? चलिए, so step by step breakdown करते हैं. Pilocarpine is a type of cholinergic agonist. So cholinergic agonist which will stimulate which receptor? M receptor. Which will stimulate which receptor? M receptors only. It is a cholinomimetic. Okay. So M receptors. If M receptors are activated, they will activate the parasympathetic activity. So parasympathetic nervous system, if it is active, so what will happen? Sweating will occur. Yes, sweating will occur. Why sweating? Because so sweating to sympathetic activity, and sweating will occur because of M cholinereceptor activation. Because in the sweat gland, M3 receptors are located. This is an exceptional case. Okay. So all of you are saying C, but some of you are saying what is that? D. Let's see. Okay, sweating will be there. Then increase of parasympathetic activity. So definitely increase of salivation will be there. Right, sweating will be there, salivation. Now parasympathetic effect on the eye which will undergo mydriasis or meiosis. Parasympathetic activity, meiosis. It will cause a meiosis. What is that? Meiosis. Okay, so what we are not going to see, हाँ जी sir, क्या नहीं दिखेगा? Cycloplegia कब होता है? Cycloplegia is a type of paralysis of ciliary muscle. What is that? Paralysis of ciliary muscle. Okay, अब आगे आंसर, ciliary muscle, paralysis of ciliary muscle. And paralysis of ciliary muscle is caused by which drugs? Anticholinergics such as, what is that? Such as cholinergics such as your tropicamide and atropine. Okay, ये हो गया तुम्हारा cycloplegia का story. Okay, clear? Hope everything is clear. Now. Cycloplegia is the answer. Okay. So what happened, Mas? Any doubt? If you have any doubt, you can just put there. Okay. Which of the following is a relatively cerebroselective anticholinesterase found to afford symptoms improve in a Alzheimer disease? Basically सीधा पूछ रहा है. अरे सीधा बोल सकते हो ना. Alzheimer का ड्रग ऑफ चॉइस क्या है? सेरेब्रो प्रोटेक्टिव, 1 घंटा सब लगा के क्यों कंफ्यूज कर रहे हो, है ना? सो ऐसे काम करते हैं हमारा एग्जाम्स में. ठीक है. See, if my time, so definitely if my time permits, I will do for ophthalmology, but usually I'm not comfortable with teaching ophthalmology. If you come to any other subjects, definitely we can help you. That is not a problem. I can help you with subjects like, for example, you get doubts on surgery and some things, but I'm not a little comfortable with opthal. That might create a bad this thing for you also. So that is why I try to avoid, but I'll try to do as much as possible. Okay. Okay. All right. What is the drug of choice for this one? What is Alzheimer disease? Very good. The drug of choice is donepezil. What is the drug of choice? Donepezil. What is that? Donepezil. Donepezil is a very, very important MCQ. What is the drug of choice for Alzheimer? पूछा जाता है. So donepezil. Pyridostigmine is used in, what is that? Myasthenia gravis. Okay. Gemfibrozil is a type of fibrate. It is a type of fibrate which is used for that. It will decrease the cholesterol level. It will decrease the cholesterol levels. Okay. All right. चलिए आगे बढ़ते हैं. Let's go to the next question. ये सारे direct answers. Okay. All of these are direct answers. कोई टेंशन लेने की जरूरत नहीं. Okay. All right. The next question is dorazolamide is a dorazolamide. पहले एक बात सुनो. Carbonic anhydrase inhibitor. What is that? Carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors. बच्चों, there are few drugs. There are some drugs called as acetazolamide, and we have drugs like brinzolamide. What is that? Brinzolamide, not brinjol, it's brinzolamide. Okay, मैं ऐसे एक मजाक में pronounce कर दिया, आप भी जाके brinjol मत बोल देना. It's called brinzolamide. Stylish. Okay, brinzolamide. Okay, then we have one more drug that is only called as dorzolamide. What is that? Dorzolamide. Okay, now among these drugs, the answer is no. Acetazolamide is a systemically used drug. It is used systemically. It is used systemically. Okay. ट्रायाज में टैगिंग में डिफरेंस क्या होता है सर? टैगिंग इज समथिंग लाइक यू आर टेलिंग दिस पेशेंट इज दिस, लाइक यू आर टेलिंग लाइक ओके ये दिस पेशेंट इज हैविंग दिस टाइप ऑफ दिस थिंग. ओके, ट्रायाज में क्या है कि तुम प्रायोरिटी देके यू हैव टू डू द प्रायोरिटाइज एंड यू नीड टू सेलेक्ट द पेशेंट. पेशेंट सिलेक्शन इज ट्रायाज. टैगिंग मतलब बस तुझे ये है, तुझे ये है, ऐसा नाम देना बस. चलो, this brinzolamide and dorzolamide, both of them are a topical carbonic anhydrase inhibitor which are used in glaucoma, sir, which are used in glaucoma. So the answer is applied in a ophthalmological preparation for your, what is that? Yes, for your glaucoma. Okay. Chalo, let's go to the next aspect. Select the diuretic that is most effective in acute congestive glaucoma. Acute congestive glaucoma. So the drugs are indipamine, amyloid, mannitol, and furosemide. What is the drug of choice? So acute congestive glaucoma is also called as buphtalmus. Buphtalmus. It is also called as buphtalmus. So patient will have painful, very painful, swollen red eye. Swollen red eye. Okay, so they will come to the emergency to you. They'll come to the emergency to you. So what is the drug of choice you are going to give? So the drug of choice what we are going to give in this patient is your, what is that? The drug of choice is mannitol, sir. What is the drug of choice used? Mannitol. What is that? Mannitol. Okay. सर यू लाइक C2H5OH यार, ये पुराना वे ऑफ आस्किंग. ओके, तो ये वो सब थोड़ा ना पब्लिकली रिवील कर देंगे. ठीक है. सो C2H5OH लाइक बहुत पुराना टेक्निक है. पेरेंट्स के सामने ऐसा बात करने के लिए बहुत सारे लोग यूज करते हैं आजकल के टाइम पे, सेइंग दैट कि C2H5OH एंड ऑल. ओके, सो पब्लिकली सब नहीं बात करना चाहिए. Okay, what is the drug of choice for this one? What is that? Acute congestive glaucoma. The answer is mannitol, sir. What is the answer? Mannitol. Okay, so once we are done with that, let's go to the next important. What is the most important drug in the treatment of organophosphate poisoning? Atropine sulfate, prolidoxin, diazepam, adrenaline. इन सब में से कौन सी important है? जल्दी बताओ, जल्दी बताओ. Give me the answer quickly. चलो बताओ जल्दी. Which is the most important drug in treatment of organophosphate poisoning? The most important drug in organophosphate poisoning. Come on, quickly give me the answer. अब तो आसान है, AP, OP poisoning तो बहुत आसान है. So the first antidote is atropine sulfate. Atropine sulfate. Okay. So यहाँ पे मैं एक point बताना है. Signs of atropinization. Signs of atropinization. Atropinization. मतलब sufficiently you have given atropine. कब पता चलेगा? Sufficiently you have given atropine. Signs of atropinization. So after giving atropinization, जो patient organophosphate poisoning में meiosis लेके आता है, right? Meiosis लेके आता है. So this meiosis should become midriasis. Meiosis should become midriasis. Okay, meiosis should be midriasis. Then apart from that, there should be increase of heart rate, and also there should be decrease of secretion. So these are the signs of atropinization. Okay, prolidoxin, yes, we can use it in the OP poisoning. It is an enzyme reactivator. It is an enzyme reactivator. But not used in, it is first point reactivator, and second point not used in carbamates. Not used in carbamate poison. Not used in carbamate. Clear everybody? So this is the story of your all the important questions from your pharmacology. And pharmacology का सिर्फ क्वेश्चन मत देखना, मैंने क्लास पढ़ाते हुए whatever I told these are important with the question, जितना भी मैंने explanation दिया हुआ है that is very important for you बच्चों, ठीक है। ये बहुत इंपॉर्टेंट एक्सप्लेनेशन, क्योंकि वो एक्सप्लेनेशन इज नॉट जस्ट है व्हाई दैट इज करेक्ट आंसर, बट आई हैव गिवन द एक्सप्लेनेशन हाउ कैन बी क्वेश्चंस, दे कैन ट्विस्ट एंड टर्न एंड आस्क, सो wherever they put a googly ball we should be ready to hit a sixer. So like that I have explained, okay, hopefully you enjoyed the session today. So with this much being said, so we are done with 3 subjects, like we did ortho, biochem and pharmacology. Hope to see you people soon once again, and definitely we'll have other sessions with me. So that's it for today. Thank you so much. See you people in the next class, and the PDF notes will be tagged in the video description. In the video description, go and read down in the description. It will be tagged by tomorrow. It will be tagged in the video, the notes link. Okay, so yesterday's orthopedics every notes has been already shared. If we have any difficulty, you can just join into our group, Meduhub Telegram group also there. So in that also I think notes will be posted. Okay, so in that also I think orthopedics and has been posted. डर लगने की कोई जरूरत नहीं है. डर is totally common thing. Little bit डर is not bad for you, so that is totally fine. But the thing is डर के इसमें ज्यादा पढ़ना रोको मत. ओके, यू नीड टू कीप पुशिंग योरसेल्फ. ऐसा नहीं है कि डर आ गया तो मैं रुक जाऊंगा, ठीक है. डर के वजह से रुक गए होते तो तुम पहला मतलब तुम्हारा फर्स्ट गर्लफ्रेंड या बॉयफ्रेंड को प्रपोज कैसे किए होते? यस सर नो, यस सर नो. डर के वजह से रुक गए होते तो वुड यू हैव गॉन टू अब्रॉड? नो, राइट. सो प्लीज अंडरस्टैंड, डर रहेगा. बीइंग स्केर्ड इज टोटली फाइन. वी आर आफ्टर ऑल ह्यूमंस. डर के साथ साथ डर को तुम ऐसा करना चाहिए कि जितना भी डर हो, एंजाइटी हो, यू नीड टू काम योरसेल्फ एंड से वन थिंग, मैं डरूंगा या डरूंगी तो भी एग्जाम देना है. इफ आई डोंट गेट स्केर्ड आल्सो एग्जाम देना है. सो फेट इज रियलिटी इज दैट कि एग्जाम देने से हम बच नहीं सकते हैं, तो वी हैव टू एक्सेप्ट दैट एंड जस्ट कीप फोकस्ड प्रिपरेशन, ठीक है. 5, अरे भाई PD5 ब्लॉकर क्यों यूज करते हो एंजाइटी के लिए? PD5 ब्लॉकर यूज करने का एज नहीं है तुम हमसे, लाइक यू नो दैट्स नॉट योर एज. PD5 inhibitors are used for erectile dysfunction, sildenafil, right, tadalafil. Okay, all right. Chalo, thank you so much guys. See you people in the upcoming sessions. Keep preparing, all the very best and keep preparing. आपको कोई भी दिक्कत हो, कोई भी doubts, question, confusion, if you want to ask me, you can contact me on Instagram also. Instagram, Facebook, anywhere you can contact me. So that is Dear Maruti07. That will be my Insta, I think. And I'll give my phone number 7993497602. And I'll keep posting pharmacology questions also. If you want, you can follow. And here I have my number. You can contact me on Telegram or anywhere. Okay, so in all the places I'll respond from this number, no issues. But if you have any doubts, any problem आपको आता है, हम लोग तुम्हारे लिए we are always stand for you people. आप कोई डरने का जरूरत नहीं. How much anxiety, panic, whatever comes, if you are scared, we are just one call or one message away. So definitely we will talk. Maybe immediately we might not talk because maybe I'm teaching some class somewhere, I just tired and slept. Immediately if I don't talk also, definitely I will get back to you within some time, and definitely I'll help you out with any subject related or exam related, any problems. Okay, don't worry. Thank you so much. Bye bye. Good night. Spasiba. Spokojnej noche. Good night. Shubhratri.